I'm an optometrist. I'm an optometrist. And today we're going to be talking about eye floaters. So sit back and relax and let's get started. So what are floaters? They're kind of like cobwebs or little worm-like things that float around in your eyes. But they're actually vitreous gel that's liquefied. The vitreous gel is this clear substance that fills up your eye, from like the middle of your eye all the way to the back of your eye where it meets your retina. When that vitreous gel shrinks or liquefies, it forms these little worm-like strands or little clumps that float around in your eye. And typically, if you have floaters, you see them when you look at a bright background like the bright blue sky or maybe a bright white wall. How do you develop floaters? Well, as we age, that vitreous gel can start to liquefy. It can also shrink away from the retina, and when it does so, it can cause those floaters. Now, not everybody develops floaters as they age. If you look at the literature, about 60% of people over the age of 60 will have some degree of vitreous changes, including floaters. Now, there's also other conditions that can cause floaters. One is called advanced diabetic retinopathy. We can also see floaters associated with retinal detachment, retinal tears, and also high myopia. How do we treat floaters? So before I go into how we treat floaters, first I want to reassure you that floaters are usually harmless. That being said, if you do have floaters and they're really bothering you, they're kind of driving you crazy, we do have some options to help get rid of those floaters. But it's important to understand the risks and benefits of each of the treatments. So one treatment for floaters is a procedure called a Now, this is a surgery that involves going inside the eye and removing that liquefied vitreous gel and replacing it with either air or silicone oil. Now, this is the most effective treatment for floaters, but it does come with its own set of risks and complications. About 75% of people who undergo a vitrectomy for floaters are very satisfied with the results. But 25% of people are either not satisfied or their satisfaction is only fair. And that's because when you go in there to remove the floaters, sometimes you can end up with other complications. You can end up with a retinal tear, retinal detachment. You can also end up with endophthalmitis, which is an infection inside the eye. And another complication we can see is what's called a posterior vitreous detachment. So if you remember earlier, I said that floaters are caused by the vitreous gel liquefying and shrinking away from the retina. Well, if you already have a PVD or a posterior vitreous detachment, that means that the vitreous gel is no longer attached to anything. So if you go in and remove any remaining floaters, that vitreous gel has nothing to attach to and it can end up floating around in your eye. And that's called a persistent high. Another risk with vitrectomy surgery is you may need to get a second surgery to remove that silicone oil that we replaced the vitreous with. Also, the day of surgery, you will have a big bandage contact lens on your eye, and some people find that pretty uncomfortable. Also, your vision will be blurry for several days after surgery until that silicone oil clears out. And finally, some people experience dry eyes after surgery. The other option for treating floaters is a procedure called a Now, this is a non-invasive procedure that uses a laser to break up those floaters. Now, this is less invasive than a surgical vitrectomy, but it still carries its own risks and complications. About 70 to 80% of people who undergo laser floater therapy are satisfied with their results. And the reasons why they're not satisfied is similar to the reasons why people are unsatisfied with the surgical vitrectomy. You can have retinal tears, retinal detachment, endophthalmitis. And another reason is that sometimes the laser can't reach all the floaters in your eye. And that is just because the floaters are too far away from the center of your eye where the laser can reach. With this procedure, you don't get a replacement like you would with a surgical vitrectomy. But there are some studies showing that your body can reabsorb those fragmented floaters naturally. Now, with laser floater therapy. You won't have a bandage contact lens on the day of surgery, but you will have numbing drops in your eyes. And just like with the surgical vitrectomy, your vision will be blurry for several days until those fragmented floaters disperse. Now, what about just leaving the floaters alone? Well, that's an option too. Now, if you're bothered by your floaters, that's definitely not the best option for you. But most floaters are harmless, and they don't cause any long-term damage to your eyes. And that's based on multiple studies that have looked at people with floaters, even people who have severe floaters, and they found that their vision was intact. they didn't have any long-term damage to their eyes. The next question is, what can increase your risk of having floaters? Well, the biggest thing that we know of is having a history of trauma to your eye. So if you've had blunt trauma to your eye in the past, that can increase your risk of developing floaters. And that's because blunt trauma to your eye can cause that vitreous gel to liquefy. There was a study done in 2008 that looked at 900 college students, and they found that 4.3% of those students had symptoms of vitreous floaters. But if you look at those who had a history of trauma, that number jumped up to 30.4%. Also, people who have diabetes or who smoke are also at increased risk of developing floaters. What can you do to prevent floaters? Well, unfortunately, there's not a lot that you can do. As we mentioned earlier, floaters are typically age-related, and they occur when the vitreous gel shrinks away from the retina and liquefies. So, there's nothing really you can do to prevent that. However, there are some studies suggesting that taking certain vitamins and minerals, like vitamin C, vitamin E, and zinc can slow down the development of cataracts and age-related macular degeneration. And since the vitreous gel makes up the majority of the structure of your eye, those same nutrients might help prevent age-related changes to the vitreous gel. Now, if you do develop floaters, what can you do to help decrease the appearance of them? Well, one thing that's been shown to work is doing a beam ultrasound. We'll put an ultrasound probe on your eyelids, and that sends sound waves through your eye that can help break up the floaters. Now, this is not painful, but it's also not completely painless-free. You will feel a little bit of pressure on your eyelids. Another thing that can help is doing a YAG laser. Now, this is a neodymium YAG laser that we send a laser through the center of your pupil, and that laser creates a bright flash that helps break up the floaters. Again, this is not painful, but you will feel some pressure on your eyelids and some bright flashes of light. If you enjoyed this video, please make sure to subscribe. If you have any questions or comments, please drop them down below. As always, I hope you learned something new here today. Thanks for watching. Smell in your teeth is a very common problem. In fact, it's so common that there are different types of smell in the mouth. Now, if you have a bad breath or a smelly mouth, what are some of the reasons? Some of the reasons could be because of an infection. It could also be because of certain foods that you've eaten, or it could be because of poor dental hygiene. In this video, we will look at why you might get a smell in your tooth and what you can do about it. The second part of the video, we'll look at why you might get pain in your teeth and what you can do about it. So let's start with the smell first. If you get a smell in your tooth, there are a number of reasons why this could be happening. The first reason is because you might have decay in the tooth. And this is because when the decay starts to eat away at the tooth enamel, it starts eating away at the inner tooth as well. And that inner tooth contains the pulp, which has lots of bacteria in it. That's why it smells. If you have this problem, don't worry. It's not the end of the world. It can be treated by root canal treatment, but you should definitely see your dentist about it. The next reason is because you might have food stuck between your teeth. When you eat, especially certain soft foods, they can get stuck between your teeth. This then starts to rot, and that's where you get the smell from. What you need to do is to make sure that you floss regularly to get rid of any food particles stuck between your teeth. If you find it difficult to floss, then speak to your dentist or your hygienist, and they can show you how to do it properly. Another reason is because you haven't been brushing your teeth properly. You need to brush your teeth at least twice a day for 2 minutes each time. Make sure you use fluoride toothpaste and you're brushing all the surfaces of your teeth. If you haven't been doing this and you've just started, you may notice a big difference in the smell of your breath, but you may also notice a change in the taste in your mouth. Now, if you would like to learn more about how to brush your teeth properly, click on the link here and it will take you through to another video which will show you exactly how to do it. Another reason for getting a smelly mouth or a bad breath is because you might have gum disease. And gum disease happens when there is lots of plaque and calculus on your teeth and below your gum line. This irritates your gums, making them red and swollen. As you know, bacteria and plaque is the cause of this. And when you have lots of this, especially below the gum line, this is where you get bad breath from. Now, To prevent gum disease, make sure you're brushing your teeth at least twice a day for 2 minutes. Flossing regularly and visiting your dentist and hygienist for regular checkups and cleans. If you do have gum disease, don't worry, it can be treated. All you need to do is visit your dentist, and they can carry out a deep clean called a periodontal clean or a hygiene appointment. Another reason could be because you're a mouth breather. Now, if you're a mouth breather, you're more likely to get dry mouth, which then leads to bad breath. If you think you're a mouth breather, make sure you visit your dentist and they can refer you on to an orthodontist who can help you to breathe properly through your nose. The other reasons are things like smoking, drinking, alcohol, having a dry mouth, eating certain foods like garlic and onions. These can all cause bad breath. So make sure you cut down on these and drink plenty of water to keep your mouth moist. And this should help with the bad breath. Now let's move on to the second part of the video, which is looking at toothache. There are many reasons why you may get toothache, and these are some of the most common ones. The first one is because you've had something really hot or cold, and that causes the dentin, which is the layer under the enamel, to become This is called dentin hypersensitivity, and it's very common. One way of treating this is to use a toothpaste that contains potassium nitrate, because this reduces the amount of acids produced by the bacteria in your mouth. Another way is to use a soft bristle toothbrush, so you don't aggravate the exposed dentins. If you do have exposed dentin in your teeth, this makes it easier for the bacteria to get to the dentin and cause sensitivity. The other reason could be because you have a cavity or decay in the tooth. As we've mentioned before, decay starts off as a white spot, and if you don't treat it, it starts to turn into a brown or black area. That's when you know you have a cavity. Now, if you have a cavity, it's important that you visit your dentist, and the only treatment for a cavity is a filling. So make sure you book an appointment with your dentist and get that checked out. Another reason for toothache is because you have gum disease. Now, gum disease is caused by plaque and calculus. And when you have gum disease, you may notice that your gums are red and swollen and bleeding when you brush your teeth. To treat gum disease, you need to visit your dentist or hygienist, and they can carry out a deep clean to remove all the plaque and calculus above and below the gum line. Another reason could be because you've bitten into something hard and cracked or fractured your tooth. If this has happened, it's important that you visit your dentist as soon as possible, because it could lead to an infection. The dentist can then put a filling in to restore the tooth back to its normal function. Another reason could be because you're grinding your teeth or you're clenching your teeth at night. You may not even know that you're doing this. But as a result of grinding your teeth, it wears the enamel away. It leaves it sensitive, and you may notice that you have toothache during the day. The best thing to do if this is happening is to visit your dentist. They can then give you a mouth guard to wear at night to stop you from grinding your teeth and causing further damage. The last reason is because you may have a sinus or an infection in the tooth. Now, if you have a sinus or an infection, this is when the bacteria gets into the pulp of the tooth, which is inside the tooth, and this causes an abscess to form. This is very painful, and the only treatment for this is root canal treatment. Now, if you have an abscess on the tooth, you may notice that you have a swelling in your face or your gums may be swollen around that tooth. Now, what you should do is go to your dentist and they can drain the abscess and then start off root canal treatment to treat the tooth. We hope you found this video useful. If you did, please give it a thumbs up. Also, remember to book your dental checkups with your dentist and hygienist so they can monitor your oral health. Thank you for watching, and we'll see you next time. Hey everyone, it's me with the Health and Wellness channel. And today we are talking about pain in your arms. So, many people complain of having pain in their arms. It could be in the upper arm, the elbow area, or even down into the hands and fingers. Pain in the arms is a very common complaint. Now, when we look at the nerve supply to the arm, the way that we become paralyzed or have weakness or pain is typically related to one of two nerve roots. It'll be either coming from the C5, C6 nerve root out of the neck, or the L4, L5, or S1 nerve root out of the low back. Now, occasionally, it can come from other areas, but those are the three most common places. So, if you have pain right now in your arm, the first thing I want you to do is to try to figure out which arm it is, which side it is, because this will give us a clue as to where the problem is coming from. Because the C5, C6 nerve roots control the right arm, whereas the left arm is controlled by the C7, C8, T1 nerve roots, and then the L4, L5, S1 nerve roots control the left arm. So, if you've got pain in your right arm, it's more likely to be coming from the neck. If you've got pain in your left arm, it's more likely to come from the low back. But again, that's not 100% the time. So, there are exceptions to every rule. The next thing you need to ask yourself is there any numbness or tingling? Because if you have numbness or tingling along with the pain, it's much more likely to be nerve-related. Okay? So if you have just pain, it could be a muscle strain or some type of irritation to a tendon or maybe even a stress fracture in a bone. But if you have numbness and tingling along with it, it's usually going to be a nerve issue. And with the nerve issue, it's more likely to be coming from the neck or the low back. So, what you need to do first is figure out which arm it is, and then also see if there is any numbness or tingling along with it. Then it'll help you narrow down where the problem may be coming from. If it is coming from the neck, you might have pain when you move your neck in a certain direction. You might feel like you've got a neck strain, or there could be some arthritis in the neck. Or if it's coming from the lower back, you might have pain when you bend forward or when you stand up from a seated position. You might have some low back pain when you move in certain ways. So, the first thing to find out is where the arm pain is coming from. Is it coming from the neck or the low back? Or is it coming from somewhere else? The next thing I want to talk about is the difference between having pain in your arm while you're lifting something and having pain in your arm while you're doing other activities. So, let's say, for example, that you're at work and you're using a computer mouse and you start getting this sharp pain in your arm, or maybe even into your hand and fingers. That would be considered a kind of a static posture type of pain. Static postures are usually repetitive in nature, meaning that you're doing the same motion over and over again and it's causing an irritation to a nerve or to a structure in the neck or in the shoulder. Usually in the shoulder girdle. There's a lot of things that can cause pain in the shoulder girdle, including things like impingement syndrome, inflammation of a tendon, or a tear in a tendon, or even instability of the joint itself. On the other hand, if you have pain in your arm while you're lifting something heavy, that's a different scenario altogether! That S usually related to a muscle strain in the neck or in the shoulder, or even down into the arm. If you lifted something heavy and you felt a pop or a snap in your shoulder or in your neck or even down into your arm, that's a good indication that you may have torn a muscle or a tendon in that area. If you have pain while you're lifting something heavy, sometimes it's hard to pinpoint exactly where the pain is coming from. If you have pain in your arm, does it mean that you pulled something in your arm in your shoulder, or did you injure something in your neck? Sometimes it can be difficult to tell. So, it really starts with figuring out if the pain in your arm is being caused by something in your neck, in your shoulder, or is it coming from somewhere else? Let's talk about what causes pain in the arm. Like I said before, if it's coming from the neck, it could be coming from a pinched nerve in the neck. The nerves that go down into the arm are called the brachial plexus. The brachial plexus is formed by the C5, C6, C7, C8, and T1 nerve roots. Those 5 nerve roots make up the brachial plexus, and they come down and they go through the armpit. So, if there's any problem with one of those nerve roots in the neck, it can cause pain in the arm. If you have pain in your arm that is caused by a C5 or a C6 nerve root, it's usually going to be accompanied by some type of numbness or tingling down into the arm. And you may even have weakness in some of the muscles in the arm. So, if you have a C5 injury, you LL have pain in the arm, and then you L also have some weakness with certain motions of the shoulder and the arm. So, you might have trouble lifting your arm up or away from the body. Certain motions will cause the pain to come back. And that's usually indicative of a nerve issue. And it's usually coming from a problem in the neck. Just as an example, if you have pain in your arm and you have a hard time lifting your arm straight out to the side like this, that could be a C6 type of palsy or injury. A C5 is more of a problem with lifting the arm up. An AC6 is more of a problem with lifting the arm out to the side like this. Again, that doesn't always happen. That's just generally speaking. It all depends on where the injury is within the nerve route itself. If it's coming from the low back, it's usually going to be one of the L4, L5, or S1 nerve roots. If it's coming from the low back, you might have some pain when you bend forward. You might not be able to bend down and touch your toes without feeling pain. Or when you stand up from a seated position, that can really aggravate a disc in your back. So, if you have a disc bulge or a slipped disc in your lower back, standing up from a seated position can really aggravate it. Or even going up and down stairs, sitting for a long period of time, standing for a long period of time, walking, going on an incline. All of these things can put pressure on the discs in your back, and that can cause pain in your arm. It's important to figure out where the pain is coming from. Are you getting it in your neck? Are you getting it in your arm while you're holding a phone in your hand? Are you getting it while you're using a computer mouse? Are you getting it while you're lifting something heavy? Are you getting it while you're sleeping on your shoulder? There are so many scenarios in which you can get pain in your arm. The key is to figure out what activity makes it better or worse. And this will give you a clue as to what the problem might be. If you have pain in your arm and you're trying to figure out what caused it, think about what happened right before the pain started. Did you sleep on it funny? Did you use your arm in a different way than normal? Did you lift something heavy? Did you have a trauma or an injury to the area? Was it gradual in nature? Did it start getting worse over a period of days or weeks? All of these things will give you a clue as to what the problem might be. Is it a muscle strain in the shoulder? Is it a nerve problem in the neck or in the low back? Is it a joint problem? Is it a rotator cuff problem? Is it an impingement type problem? There are so many things that can cause pain in the arm. But the key to finding out what it is to figure out where the pain is coming from and figure out what activities make it worse and what activities make it feel better. This will give you a clue as to what the problem is. I hope this helps. If you have any questions or comments, please put them below. I'd love to hear from you. Thanks for watching. Don't forget to subscribe, and I'll see you in the next video. Don't ignore it. There's no such thing as a mini stroke. Every time you have a warning sign, you need to take action. That means making an appointment with your doctor and getting checked out, not putting it off. You see, every warning sign is important because it's telling you that something is wrong. And even if the symptoms go away, your doctor can still do tests to figure out what's going on. And remember, it's much better to be safe than sorry. Ignoring these signs could be dangerous. No. 2 is trouble speaking or understanding speech. Did you know that nearly half of all strokes affect a person's vision? Yep, that's a big deal. You might be thinking, hey, I've got that one eye that's always kind of giving me trouble. Surely, that's just a little annoying, but not a big deal, right? Wrong. Vision problems are actually a common symptom of a stroke, especially if they happen suddenly in the morning. We're talking about blurry or double vision, seeing things that aren't really there, or even losing your peripheral vision. Now, here's what you need to know.
Many people suffer from leg cramps, especially during pregnancy or while sleeping. In this video, we will be discussing about what causes these cramps, who is at risk of getting them, and how to get rid of leg cramps. So make sure you watch the video till the end to know more about leg cramps. Hello everyone. Welcome back to our channel. We have already made videos on different types of stitches and how to get rid of them. If you are interested in that, then click on the I button above. Today we will be talking about a very common problem which many of us face and ignore. We are talking about leg cramps. Leg cramps can be defined as painful muscle contractions that occur in your lower legs. They usually feel like a tightening or cramping sensation. The cramp may be felt in your calf muscles or in your thigh muscles. It can affect one leg or both legs, and it can last anywhere from a few seconds to several minutes. While most leg cramps are harmless and go away on their own, they can be quite painful and annoying. Leg cramps can occur because of various factors like dehydration, overexertion, poor blood circulation, nerve problems, and nutritional deficiencies. In this section, we will be talking about different types of leg cramps and their causes. One type of leg cramps is called a nocturnal leg cramp, also known as night cramps. These are painful muscle cramps that occur when you are asleep and usually happen in the second half of the night. As mentioned earlier, these cramps may be felt in your calf muscles or in your thigh muscles and may affect one leg or both legs. One cause of nocturnal leg cramps is dehydration. This happens because you don't drink enough water throughout the day, so that when you sleep at night, your body gets dehydrated, causing leg cramps. Another reason could be that you're not getting enough potassium or magnesium in your diet. Also, certain medications like diuretics can increase your risk of getting night cramps. People between 50 to 70 years of age are more prone to nocturnal leg cramps. However, athletes are also susceptible to night cramps due to overexertion. Another type of leg cramp that occurs during pregnancy. As you might guess from the name itself, these cramps occur because of hormonal changes and other physiological changes happening in your body during pregnancy. These cramps can happen any time, but they are more likely to occur during the third trimester. Some pregnant women also complain of persistent leg cramps even after delivery. Leg cramps during pregnancy can be eased by staying active, elevating your feet, and massaging your calves. Also, eating foods rich in potassium and magnesium like bananas and avocados can help you prevent these cramps. Next, we will be talking about exercise-induced leg cramps. As the name suggests, these cramps occur as a result of overexertion during exercise or physical activity. This is usually caused by dehydration or electrolyte imbalance, especially after sweating a lot. Exercise-induced leg cramps are common among athletes, especially those who train for long hours or don't take proper care of their bodies before or after exercise. To prevent these cramps, it's important to stay hydrated by drinking plenty of water, especially during and after exercise. Also, consuming sports drinks containing electrolytes like sodium and potassium can help prevent cramping. Proper warm-up and cool-down exercises are also necessary to reduce the chances of getting exercise-induced leg cramps. We have already discussed some of the causes of leg cramps. Now we will be going through risk factors that may increase your chances of developing leg cramps. The first one being pregnancy. We have already discussed earlier that leg cramps are very common. During pregnancy, due to hormonal changes and increased pressure on your legs, the next factor is overuse or overexertion. Athletes and people with sedentary jobs are more prone to leg cramps because they put a lot of pressure on their leg muscles without giving them enough rest. Poor blood circulation can also cause leg cramps. This can be because of various factors such as smoking, diabetes, peripheral artery disease, and heart disease. Also, people who stand or sit in one position for a long time are more at risk of developing leg cramps due to poor blood circulation. Next, nerve-related problems like pinched nerves or herniated discs can compress the nerves that go to your legs, resulting in leg cramps. Lastly, nutritional deficiencies like low levels of potassium, magnesium, and calcium can also lead to leg cramps. Now let's talk about signs and symptoms of leg cramps. Leg cramps can manifest themselves in many ways, but the most obvious symptom is obviously pain. This pain can range from mild discomfort to severe cramping and may feel like a tightening or pulling sensation in your leg muscles. The cramped muscles may also feel warm and may appear swollen or taut. You may also notice visible muscle twitching or fasciculations in the affected area. Other symptoms include numbness, tingling, and weakness in your legs. In severe cases, you may even lose the ability to move your leg or ankle joints. Now we will be going through various tests and diagnosis methods used to diagnose leg cramps. There is no specific test to diagnose leg cramps, so your doctor will perform a physical exam and ask you about your symptoms to determine the underlying cause. They will check your reflexes, muscle strength, and sensation in your legs, and may also perform special tests to evaluate your balance and coordination. Imaging tests like X-rays, MRI, or CT scans may be done to rule out any serious underlying conditions like tumors or vascular problems. Nerve conduction studies and electromyography may be performed to assess your nerves and muscles. Blood tests can also be done to check for nutritional deficiencies or other medical conditions that may be contributing to your leg cramps. Now we will be discussing treatment options for leg cramps. Treatment of leg cramps depends on the underlying cause, so it is important to get a proper diagnosis from your doctor to receive the right treatment. One way to treat leg cramps is by changing your lifestyle. This includes staying hydrated by drinking plenty of water, eating a balanced diet rich in vitamins and minerals, and getting regular exercise. You can also try massaging the affected area to improve blood flow and relax the muscles. Another way to treat leg cramps is by taking medications. Over-the-counter pain relievers like ibuprofen or acetaminophen can help relieve pain and inflammation. In some cases, your doctor may prescribe muscle relaxants or anticonvulsant medications to reduce cramping. For more severe cases, your doctor may recommend physical therapy to strengthen your leg muscles and improve your balance and coordination. In addition to the treatment, there are also ways to prevent leg cramps. First one being staying hydrated. Dehydration can contribute to leg cramps, so it is important to drink plenty of water throughout the day. You can also try consuming sports drinks containing electrolytes like sodium and potassium, especially after sweating a lot. Another way to prevent leg cramps is by maintaining good blood circulation by getting regular exercise, avoiding smoking, and managing underlying medical conditions like diabetes. You can also prevent leg cramps by eating a balanced diet that is rich in vitamins and minerals like potassium, magnesium, and calcium. Also, if you are an athlete, make sure to warm up properly before exercising and cool down afterwards. If you find this video informative or helpful, then please like, share, and subscribe to our channel. Also comment down below if you have any queries or questions regarding leg cramps. We will see you in the next one. Until then, stay fit and healthy.
Hi everyone, welcome back to our channel where we have been educating people about various health issues and providing ways of treating them naturally. In this video, we are going to be talking about leg cramps, especially the ones that occur in your feet. We will also tell you how you can get rid of the pain and cramps in your feet. So, if you are interested, make sure to watch this video till the end. Before we begin, we would like to ask you to please like and subscribe so that you can receive the notification whenever we post a new video. Also, be sure to share this video with your family and friends if you find it helpful. And lastly, don't forget to hit the bell icon to get notified when we post new videos. Now, let's get started. First, we will talk about the causes of foot cramps. The most common cause of cramping in your legs is dehydration. If you don't have enough water in your body, it can cause your muscles to cramp up. This is because when you're dehydrated, your body tries to conserve water and that can lead to reduced blood flow to your muscles. It can also result in an electrolyte imbalance, which can trigger cramps. Electrolytes such as sodium, potassium, and magnesium help regulate muscle contractions and relaxations. So if one or more of these electrolytes are out of balance, it can cause cramps. Another cause of cramping in your legs is overuse or overexertion. If you work out too hard or for too long without giving your body enough time to recover, it can cause your muscles to become fatigued and start cramping. This is especially true if you are not used to the amount of exercise you are doing. For example, if you suddenly start working out much harder than you used to, your body may not be able to adjust quickly enough and you may experience cramps as a result. It is important to listen to your body and take rest when you need it. Do UNT push yourself too hard, and do UNT increase the intensity or duration of your workouts too quickly? Poor circulation can also cause cramping in your legs. If your arteries are narrowed or blocked, it can reduce blood flow to your muscles and cause them to cramp up. This is often caused by conditions such as peripheral artery disease, which is a condition that affects the arteries in your legs and feet. PAD is usually caused by the same things that cause heart disease, such as high blood pressure, high blood sugar levels, and high cholesterol. These things can damage the lining of your arteries and make them narrower, which can block the flow of blood. Nerve problems can also cause cramping in your legs. If the nerves that control your muscles are damaged or diseased, it can cause your muscles to contract and not relax, which can lead to cramps. This is often caused by conditions such as peripheral neuropathy, which is a disease that affects the nerves in your legs and feet. It is usually caused by diabetes, alcoholism, kidney disease, and some medications. Now, let's talk about the symptoms of pain and cramping in your feet. The main symptom is obviously pain and cramping in your feet. The cramps may feel like a sharp, sudden pain or a dull, aching pain. You may also notice that your feet are swollen or numb. In severe cases, you may also have trouble moving your feet or ankles. If you are experiencing any of these symptoms, it is important to see a doctor as soon as possible so that they can determine the underlying cause and recommend the appropriate treatment. Now, let's move towards the diagnosis. The first step in diagnosing pain and cramping in your feet is to take a detailed medical history and perform a physical examination. The doctor will ask you about your symptoms and how long you have been experiencing them, as well as any other medical conditions you have. They will also ask you about any medications or supplements you are taking. The doctor will also examine your feet and check your reflexes and muscle strength. After the initial evaluation, the doctor may order some tests to help diagnose the underlying cause of your pain and cramping. These tests may include blood tests to check for signs of dehydration or electrolyte imbalance, an X-ray to rule out any bone or joint problems, or an ultrasound to check for signs of poor circulation. In some cases, the doctor may also order a nerve conduction study or electromyography to check for signs of nerve damage. The treatment of pain and cramping in your feet depends on the underlying cause. If your cramps are due to dehydration, the doctor will recommend that you drink more fluids, especially water. If your cramps are due to an electrolyte imbalance, the doctor may recommend that you eat foods that are rich in the necessary electrolytes such as bananas, potatoes, and avocados. Or they may also recommend that you take electrolyte supplements. If your cramps are due to poor circulation, the doctor may recommend that you exercise regularly and eat a healthy diet, low in saturated and trans fats, cholesterol, and salt. They may also recommend that you quit smoking and limit your alcohol intake. If your cramps are due to nerve problems, the doctor may recommend that you take pain medication or In some cases, the doctor may also recommend physical therapy to help improve your balance and coordination. Apart from the treatment recommended by your doctor, there are also some home remedies that you can try to relieve pain and cramping in your feet. One is to soak your feet in warm water for 15 to 20 minutes. This can help relax your muscles and improve circulation. Another remedy is to massage your feet. This can also help improve circulation and relax your muscles. You can also try applying heat to your feet using a heating pad or hot towels. This can help reduce inflammation and pain. Lastly, you can also try stretching your feet. This can help improve flexibility and range of motion in your feet and lower legs. We hope this was helpful. If you enjoyed our content, please leave a like and subscribe so you won't miss any future videos. Feel free to comment down below if you have any questions, and we try our best to answer them. Thanks for watching, and see you in the next one. Now let's have a look at some frequently asked questions related to the topic. Q1. What are the vitamins good for leg cramps? The B-complex vitamins, particularly B1, B6, and B12, are essential for maintaining healthy nerve tissue and can help prevent cramps. Additionally, vitamin D is also thought to play a role in muscle function and may help reduce the risk of cramps. Q2. How do you get rid of a cramp in your foot fast? One way to get rid of a cramp in your foot fast is to stretch the affected muscle. For example, if you have a cramp in your calf, you can stand up and bend your knee and point your toes up towards your nose. Hold this position for 30 to 60 seconds until the cramp subsides. You can also apply heat to the affected area using a heating pad or hot towel. This can help relax the muscles and improve circulation. Q3. Can low potassium cause foot cramps? Yes, low potassium levels can cause muscle weakness and cramps, including those in the feet. Potassium is an essential nutrient that helps regulate muscle contractions. When your potassium levels are low, your muscles may not function properly and may become more prone to cramping. Q4. What is the best exercise for cramps in your legs? One of the best exercises for preventing and relieving cramps in your legs is stretching. Stretching can help improve circulation, lengthen your muscles, and increase flexibility. A simple hamstring stretch can be done by standing up and bending forward at the waist with your knees straight. Hold this position for 30 to 60 seconds until the cramp subsides. Q5. What is the difference between a pinched nerve and a cramp? A pinched nerve typically causes a sharp, shooting pain along the path of the nerve, while a cramp is more of a dull, aching pain that often feels like a knot in the muscle. Pinched nerve may also cause numbness, tingling, or weakness in the affected area, while a cramp usually does not. Thank you for watching. See you in the next video. If you're suffering from inflammation, joint pain, gut issues, or other problems caused by inflammation, then you might want to consider taking this one herb. And it's definitely not turmeric. Coming up, let us talk about what this amazing herb is that has been shown to crush inflammation better than turmeric. And it's not even close. We'll also uncover why green tea doesn't work as well as they say it does. If you're new here, I'm a leading expert in the field of natural health. Welcome. So let's talk about this herb that's so powerful when it comes to crushing inflammation. That's right, this herb can put inflammation in its place. The question is, how do we know that? Because of the clinical studies! There are many clinical studies that show the incredible benefits of this herb. Let's start with the journal Drug and Chemical Toxicology. This study shows that this herb can stop the inflammatory process before it starts. It's called anti-inflammatory. In fact, there was an 80% reduction in inflammation with just this herb alone. And so this is really powerful because you can take this herb as a preventative measure to avoid getting sick in the first place. Now, let's look at another study that was done in the European Journal of Clinical Nutrition. What they did is they took 40 healthy people and they divided them into two groups. One group received 3 grams of this herb 3 times per day. The other group got a placebo. And what they found is that those people that took this herb had a 72-hour reduction in inflammatory markers. So that's very quick. 72 hours. What about the placebo group? They didn't see any changes whatsoever. In addition, this herb is also good for your liver, your heart, your brain, your gut, your joints, and so much more. So let's go back to the beginning. What is this magical herb? It's called Boswellia is a natural remedy that comes from the Boswellia tree. It's been used for thousands of years in Ayurvedic medicine. Now, Boswellia is often used for inflammatory conditions like arthritis, but it's good for much more than that. In fact, Boswellia is good for anything that relates to inflammation. Like I mentioned earlier, that could be your liver, your heart, your brain, your gut, your joints, your skin. Boswellia has a very unique compound called boswellic acid. It's this little molecule that gets into the cells and blocks something called 5-light. And this is the enzyme that makes inflammatory hormones like prostaglandins. By blocking this enzyme, Boswellia stops the production of these inflammatory hormones. And that's why it's such a powerful anti-inflammatory. And this is where it gets interesting. Curcumin, which is an extract from turmeric, also blocks this same enzyme. But there's a big difference between Boswellia and curcumin. Boswellia has a bioavailability issue, meaning if you take it, your body absorbs it. It gets into the bloodstream, but it doesn't stay there very long. It gets metabolized by your liver and it turns into a sulfate and and this is where a lot of people get confused. When they look in their urine, they see these two metabolites and they think that they're not being healed. However, these metabolites are actually the inactive forms of boswellic acid. They're kind of like the waste product. After your body digests boswellic acid, just like when you eat food, some of the waste gets eliminated through your urine. Well, this is the same thing. So don't be fooled by seeing these metabolites in your urine. It's totally normal, and it's expected. Even the clinical studies showed that these metabolites were present in the urine. So please don't be concerned. It's working. Turmeric, on the other hand, has a similar bioavailability issue. The active compound curcumin is also metabolized by your liver, and it also turns into inactive metabolites that are eliminated through your urine. This is why you do see a lot of clinical studies on turmeric, because it's not bioavailable. It doesn't stay in your body long enough to produce a therapeutic effect. On top of that, there are so many variables that you have to control for when you're redoing a clinical study, like dosage, extraction method, concentration of curcumin, etc. And that's why it's difficult to find high-quality studies on turmeric. However, we do have some really good human studies on boswellia. For example, there was a randomized double-blind placebo-controlled trial where they gave boswellia to people with osteoarthritis, and they found that the boswellia group had significantly less pain and less disability compared to the placebo group. Another study looked at people with asthma. They found that boswellia significantly reduced the symptoms of asthma. It also improved their lung function. They even mentioned that it was comparable to prednisone, a powerful anti-inflammatory medication. And the best part is that there were no side effects with So why would anyone take turmeric instead of Well, first of all, turmeric is cheaper. It's easier to get, and it's more widely studied. However, like I mentioned earlier, it's very difficult to find high-quality studies on turmeric due to all the variables that I talked about. Plus, there's no real way to standardize turmeric because it's a rhizome. It grows in the ground. It's kind of like trying to standardize the sun. You can't do it. It's impossible. So what you're getting with turmeric is kind of a hit or miss. On the other hand, boswellia is easy to standardize because it comes from the boswellia tree. All you have to do is count the number of boswellia lactans and you know exactly how strong the extract is. This is why boswellia is preferred over turmeric. I will say that some people benefit from turmeric and some people don't. And the same goes for some people benefit and some people don't. It's important to try both and see what works for you. You may even benefit from taking both together! But if you had a choice and you could only take one, you should take Now let's talk about green tea. Green tea has been promoted as a powerful anti-inflammatory for years, but is it really all that it's cracked up to be? Let's take a look at a few studies. One study looked at 60 overweight men and they divided them into two groups. One group drank 3 cups of green tea per day. The other group was the placebo group. And what they found is that there was no significant difference between the two groups. The green tea group didn't lose any more weight and they didn't have any more fat loss compared to the placebo group. Another study looked at overweight women and it was a randomized controlled trial. They had 2 groups. one group that consumed green tea and another group that was the control group. And once again, they found no significant differences between the two groups. In fact, the green tea group only lost 1.5 pounds, which is about half a kilo, while the control group lost 2.5 pounds, which is about a kilo. So, the control group lost more weight than the green tea group. In addition, the green tea group complained of a lot more side effects like headache, stomachache, nausea, insomnia, palpitations, anxiety, and fatigue. In fact, the researchers concluded that the green tea group was worse off than the control group. So why does green tea seem to help some people and hurt others? Well, it all has to do with the catechins. Catechins are plant compounds that are considered polyphenols. And yes, they do have antioxidant properties. And that's great. Your body always needs antioxidants. But there's a potential downside to consuming too many catechins. Too many catechins can deplete your body of essential nutrients like zinc, iron, magnesium, vitamin B1, and vitamin C. And this can lead to all sorts of health issues like fatigue, weakness, digestive problems, and immune system problems. On top of that, the caffeine in green tea can interfere with sleep, especially if you drink it later in the day. It can also increase cortisol and adrenaline, which can lead to anxiety, stress, and more inflammation. Now, don't get me wrong, I'm not saying that you should never drink green tea. It's just not as healthy as they say it is. You just have to weigh the pros and cons. For most people, the cons outweigh the pros. So if you want a noble tea that's truly anti-inflammatory, I recommend sticking with something like chamomile, peppermint, or hibiscus. As you can see, nature provides us with some amazing remedies. Hopefully this video was helpful. If it was, please hit the like button. This helps the video spread to more people. And if you haven't already, subscribe to my channel. I release new videos every week on a variety of health topics. Thank you so much for watching. Have a blessed day. And as always, breathe easy, move freely, and feel great. Hey everyone! Welcome back to another social skills video. In today's social skills lesson, we are going to talk about how to introduce yourself confidently and respectfully to others. This is an important social skill that will help you make a good first impression on others in many different social situations. So, if you would like to improve your social skills and learn how to introduce yourself to others with confidence and respect, then this is the video for you. I'm your social skills coach. I am a social skills coach and the founder of a social skills training program. The social skills coach helps people just like you to overcome, build confidence, and master social skills so that you can feel more comfortable in social situations and reach your relationship and communication goals. And if that's something that you want, then be sure to stay tuned for more videos and subscribe to our channel. You can also become a member of our online social skills training program where we have live coaching, live group sessions, an amazing community, and so much more. Okay, so let's jump right into the video now. So the first step to introducing yourself confidently and respectfully to others is to make eye contact and smile. Making eye contact and smiling are two of the most important things that you can do to make a good first impression on someone when you meet them. It shows that you are friendly and approachable, and it also helps to establish rapport is the connection that you make with another person when you talk to them. So making eye contact and smiling are great ways to establish a rapport when you first meet someone. So when you approach someone and you want to introduce yourself, look them in the eye, smile at them maybe, even give a little bit of a nod of your head just to acknowledge them before you actually begin talking to them. Now, of course, this is assuming that you are not in the middle of a conversation with someone else. If they are in the middle of a conversation with someone else, don't interrupt. Wait until they are available and then approach them, make eye contact, smile, and then introduce yourself. Now, I know that some of you may be thinking, well, what if I am really shy or I have social anxiety? Then just try your best. Try to look them in the eye. Try to muster up a smile. It doesn't have to be a big smile, just a polite smile, an acknowledgement. It will mean a lot to the other person that you took the time to acknowledge them and introduce yourself. Okay, next step after you have made eye contact and smiled at the person and acknowledged them is to state your name clearly. One thing that you don't want to do is to kind of mumble or be like, hi, I'm, and then they're like, what? Say your name clearly. If your name is common, you might just say your first Name. If your name is a little bit more unique, you might want to say your first and last name. When you state your name, you can also include a little bit of information about yourself, especially if you are in a situation where you don't know the other person very well. For example, you could say, my name is, I'm from such and such department, or my name is, I'm a student here at such and such school. So by including a little bit of information about yourself when you state your name, it helps the other person remember who you are, and it also gives them information about you right off the bat. Now, one thing that I will say is that sometimes there is a temptation for us to use nicknames when we introduce ourselves, and while nicknames can be cute and they can be endearing, it's usually better to introduce yourself with your full name. Nicknames can cause confusion. For example, if you have a friend whose name is Robert, but he goes by Bob, you would want to introduce him as Bob, because there could be many people at the event or the party or wherever you are that are also named Bob, so it's better just to stick with your full name when introducing yourself. Of course, if they ask you what you would like to be called, then you can share your nickname. All right, next step to introducing yourself confidently and respectfully to others is to ask the other person for their name and also repeat it back to them. One of the most important things that you can do to make a good impression on someone is to show them that you are interested in them. Asking them for their name and then repeating it back to them shows that you are paying attention and that you care. It also helps to establish rapport, and it shows that you are genuinely interested in getting to know them. There are many different ways that you can ask someone for their name. My name is... What's your name? It's nice to meet you. What's your name? Hi, pleased to meet you. What's your name? All of these are polite and respectful ways to ask someone for their name when you first meet them. Just be sure to smile and make eye contact when you ask them for their name as well. And once they have shared their name with you, repeat it back to them. By repeating their name back to them, it shows that you are listening and that you care. It also helps to solidify the connection that you have already started to make with them. So make sure to repeat their name back to them either immediately or within the first few minutes of meeting them. Next step to introducing yourself confidently and respectfully to others is to engage in small talk. After you have asked someone for their name and they have shared it with you, it is important to engage in a little bit of small talk. Small talk is the polite conversation that we engage in when we first meet someone. It is a way to break the ice and get to know someone a little bit before diving into more meaningful topics. There are many different topics that you can talk about when engaging in small talk. Here are a few. Current events, weather, sports, hobbies, travel, food. These are all safe topics that most people enjoy talking about. Just be sure to avoid controversial topics when engaging in small talk. You never know who you are talking to and what their beliefs are. So, it's best to stick to neutral topics when you are first getting to know someone. Also, keep the conversation lighthearted and positive. No one wants to meet someone who is negative and brings them down. So be sure to keep the conversation upbeat and fun. Ask follow-up questions and show that you are genuinely interested in the other person. And finally, the last step to introducing yourself confidently and respectfully to others is to end the conversation on a positive note. One of the most important things that you can do when ending a conversation is to leave the other person wanting more. You don't want to end the conversation too abruptly, or they may feel that you are being rude or that you are in a hurry. But if you end the conversation on a positive note, they will feel good about themselves, and they will be more likely to remember you. So here are a few ways that you can end a conversation on a positive note. It was nice meeting you. I hope we could talk again soon. I'm glad we had a chance to talk. You seem like a really nice person. I appreciate you taking the time to talk with me. These are all polite and respectful ways to end the conversation. They show that you were grateful for the opportunity to talk to the other person and that you enjoyed speaking with them. So, if you want to introduce yourself confidently and respectfully to others, just follow these 5 simple steps. Make eye contact and smile. State your name clearly. Ask the other person for their name and repeat it back to them. Engage in small talk and end the conversation on a positive note. Well, I hope that helped you out, and that you will be able to use this advice the next time you need to introduce yourself to someone new. If you liked this video, be sure to give us a thumbs up and share it with a friend. As always, you can also become a member of our online social skills training program. We have live coaching, live group sessions, an amazing community, and so much more. Okay, until next time, I wish you all the best in your social skills journey, and I hope that you have a wonderful day. Bye! Hello, this is your host. Today, we are discussing a topic that affects millions around the world and yet remains shrouded in misunderstanding and stigma. We call it the silent epidemic, because for a long time, it was ignored, silenced, and stigmatized. It's not just tiredness. It's more than that. It's fatigue, the kind that saps your energy, overwhelms your mind, and makes everyday tasks feel like climbing a mountain. I've been a patient for many years, and in today's video, we are doing something different. We are giving a platform to patients like me to share our experiences, challenges, and insights into this condition. My hope is to shed light on this often misunderstood struggle and show that behind each case of chronic fatigue is a person with a story worth being heard. This is the first video in our series. And if you would like to be featured, please send us an email at the provided address. Let's start with the basics. What exactly is chronic fatigue? It's a condition marked by persistent and debilitating fatigue that doesn't improve with rest. Now this is your run-of-the-mill tiredness after a hard day's work or a lazy afternoon on the couch. It's a deep-rooted exhaustion that goes way beyond a simple power nap can fix. Picture this. You wake up in the morning feeling drained. Even though you had hours of sleep the night before, simple tasks like getting out of bed seem monumental. A quick trip to the grocery store becomes a major expedition. And a day at work feels more like a week due to the brain fog that comes along with it. This isn't just tiredness. It's chronic fatigue slowly chipping away at your resolve and making every day a new battle. Now, let me ask you a question. Do you think this is a small problem? Well, you're not alone. For a long time, the medical community underestimated chronic fatigue, often dismissing it as a psychological issue instead of recognizing it as the complex physiological problem it is. But here's the harsh truth. Chronic fatigue isn't just a state of being tired. It's a severe health condition with far-reaching implications. People dealing with chronic fatigue aren't simply lazy or lacking motivation. They are battling a real and often misunderstood illness. Think of your body as a car. When you're healthy, it runs smoothly, efficiently, and with vigor. But when you develop a chronic illness, it's like throwing a wrench into the engine. Suddenly, the car isn't operating at peak performance. It's sputtering, it's struggling, and it's definitely not moving forward. That's what living with chronic fatigue feels like. Constantly fighting an uphill battle just to keep moving. To truly understand chronic fatigue, we need to look beyond the obvious. Let's dig deeper into the potential causes. One significant factor is the dysfunction in the autonomic nervous system. This intricate network controls vital functions without conscious effort. Things like heartbeat, digestion, and sleep cycles. When it's not working properly, daily tasks become significant challenges, and the simplest activities leave you mentally and physically spent. Then there are the hormonal imbalances. Hormones! These chemical messengers that regulate a myriad of bodily functions can go awry, throwing your energy levels out of whack. Even slight imbalances can lead to profound fatigue, making each day a struggle against an invisible opponent. But that's not all. Chronic fatigue often goes hand in hand with post-exertional malaise. This means that after physical or mental exertion, no matter how small, you experience a significant worsening of symptoms rather than feeling refreshed and rejuvenated. Imagine going for a walk and feeling so exhausted afterward that you have to lie down for the rest of the day. It's a perplexing and frustrating phenomenon that makes everyday living a challenge. Let's talk about the immune system. When it's compromised, your body's defense mechanism against illnesses weakens, leaving you susceptible to a range of infections. This constant battle on multiple fronts is exhausting for both the body and the spirit. And let's not forget the role of sleep disturbances. Quality sleep is essential for restoring energy and rejuvenating the body. But with chronic fatigue, sleep often becomes elusive, leaving you in a perpetual cycle of tiredness and frustration. Chronic fatigue isn't just a health concern. It's a societal issue that demands attention. Millions worldwide suffer from this condition, and many more don't even know they have it. The global prevalence of chronic fatigue is staggering, affecting approximately 26 million Americans alone, according to the Center for Disease Control and Prevention, CDC. And it's not confined to any particular region or demographic. It can strike anyone, regardless of age, gender, or background. In fact, research suggests that chronic fatigue affects men and women equally, with about 20% of those diagnosed being male and 80% being female. The numbers are even more alarming when viewed globally. The International Association of Chronic Fatigue Syndrome estimates that over 200 million people worldwide are grappling with this debilitating condition. Despite these figures, many cases go undiagnosed, and many patients are left without effective treatment options. The consequences are far-reaching, affecting not only their health, but also their social lives, careers, and overall well-being. The economic burden is also substantial, with healthcare costs associated with treating the various comorbidities of chronic fatigue estimated to be in the billions. Here's where the stigma comes in. For a long time, those suffering from chronic fatigue were judged, misunderstood, and often dismissed as lazy or lacking willpower. This couldn't be further from the truth. Chronic fatigue isn't a sign of weakness. It's a symptom of an illness that needs understanding and empathy, not criticism and judgment. The social stigma associated with chronic fatigue can be incredibly damaging. It often leads to isolation, depression, and a reluctance to seek help. Many patients feel ashamed, embarrassed, or even isolated, believing that they are alone in their struggle. The journey through a chronic fatigue diagnosis can be long and arduous. It often involves a complex process of elimination, as the symptoms mimic other conditions. It's not uncommon for a patient to visit numerous doctors, each offering a different diagnosis or treatment plan without any lasting relief. This medical maze can be frustrating, disheartening, and at times, hopeless. It is not uncommon for individuals with chronic fatigue to be labeled as having a psychiatric disorder such as depression, anxiety, or somatization disorder. This misdiagnosis is not only inaccurate, but also detrimental, as it diverts attention away from the actual underlying physiological causes of the illness. Imagine the toll this takes on a person's life. Simple tasks become major battles. Hobbies and passions are put on hold, and everyday interactions can be exhausting. The dream of a fulfilling career may seem to slip away as the struggle to balance work and this illness intensifies. It is a constant tightrope walk between pushing through the fatigue to maintain some semblance of normalcy and resting when the body demands it, knowing that doing so might mean falling even further behind. However, the impact of chronic fatigue extends beyond the individual. Families are often deeply affected as they navigate the challenges alongside their loved ones. Caregivers may face physical, emotional, and financial strain while trying to support both the patient and other family members. The illness can also put a significant dent in productivity, affecting not only the individual's career, but also the economy as a whole. As we continue to explore chronic fatigue, we must remember that behind each case is a human story, a story of struggle, resilience, and hope. It's a story that needs to be heard, understood, and acted upon. So join us as we continue to shed light on this silent epidemic. Together, we can raise awareness, drive research, and advocate for better treatments and a better understanding of chronic fatigue. It's not just a cause, it's a commitment to those who live with chronic fatigue every day. It promised to stand in solidarity and fight for a future where chronic fatigue is no longer a silent epidemic, but a stepping stone towards healing and hope. Hello, everyone! I'm a physical therapist with PT Progress. Today, we are going to be talking about some interesting facts related to death. I know that sounds kind of morbid, but stick around because they actually have to do with things like Achilles tendonitis, calf cramps, and even shin splints. So if those are things that you deal with or you want to learn about, definitely stay tuned. In the last two videos of this series, we talked about how death starts in your hips and in your feet. I know it's not something you think about very often, but there are some really important takeaways for things like injury prevention and just general movement and exercise recommendations. So, if you haven't seen them yet, I recommend checking out the first two videos in this series before jumping into this one. So let's talk about how death starts in your legs. So I guess it might help to explain what we mean by death. When people think about death, they usually think about their heart stopping or them taking their last breath. But biologically speaking, death is actually defined as the permanent, irreversible cessation of all biological functions that sustain a living organism. So basically, when you hear death, think complete body shutdown. Okay? So how does that start in your legs? Well, there are two main reasons why your legs could be the first place where you see signs of biological system shutdown. The first is because your legs are the furthest away from your heart. And the second is because your legs do a lot of work. Let's go ahead and break these down one at a time. First off, the fact that your legs are the furthest distance away from your heart. You can think of your heart as kind of like a pump that pumps blood throughout your body. And your blood vessels are like the pipes that the blood flows through. Now, in order for your heart to send blood all the way to your legs, it has to put in a decent amount of effort, especially if gravity is working against it. If you're standing upright and the blood is traveling upwards towards your legs, then gravity is working against that flow. So the heart has to pump pretty hard to get blood all the way up to your toes. And since your heart is only one organ working to keep you alive, it doesn't have infinite energy to draw from. Eventually, if your heart stops pumping as efficiently, the most distant parts of your body, aka, are going to be the first to feel the effects of that reduced blood flow. As blood flow to your legs decreases, you may notice some discoloration changes. Your legs may start to turn slightly blue or purple due to deoxygenated blood. And when blood flow decreases, you may also notice that your legs start to swell up. This happens due to a buildup of interstitial fluid, which is basically the oxygen and nutrient-packed water around your cells. Normally, that fluid moves in and out of your cells pretty easy, but when blood flow decreases, that fluid doesn't get circulated back up towards your heart to be pumped back out again. Instead, it kind of stays stagnant in your lower legs, leading to swelling. As blood flow continues to decrease, the amount of oxygen reaching your muscle cells will also decrease. Muscle cells need oxygen to make energy through a process called aerobic respiration. So when they don't get enough oxygen, they switch over to anaerobic respiration, which produces a lot less energy and creates a bunch of lactic acid as a byproduct. Lactic acid causes your muscles to feel sore and tired, which may lead to weakness and fatigue. Eventually, if your body is unable to get enough blood flow to deliver oxygen to your vital organs like your brain and heart, death will occur. Alright, now let's talk about the other reason why death might start in your legs. And that is because of all the work they do. Like I mentioned earlier, your legs are the furthest away from your heart. Not only are they the furthest away, but they're also the largest muscle groups in your body. Your glutes, quads, hamstrings, and calves alone account for almost half of your body weight. In order for these large muscles to work, they need energy. And you guessed it, they get their energy from aerobic respiration, which requires oxygen. It is estimated that the human body uses around 250 to 300 liters of oxygen per day at rest. And it turns out that the majority of that oxygen gets used by your leg muscles. That's because roughly 40% of your body's energy expenditure occurs while walking. So you can imagine that your legs are constantly drawing from your body's oxygen stores. Now, if your body is unable to keep up with demand and provide enough oxygen to your leg muscles, those muscles are going to start to fatigue. Just like we talked about earlier. However, another thing that can happen is cramping. Leg cramps are sudden, involuntary muscle contractions that can feel painful. They're thought to occur when there is an imbalance between the amount of excitation, meaning signals from your nervous system, and relaxation in your muscles. In other words, if too many signals are telling your muscle to contract without the proper number of relaxation signals, you end up with a cramp. Calf cramps are extremely common, especially among athletes and active individuals. Some research suggests that dehydration and electrolyte imbalances play a big role in the development of cramps. For example, low levels of calcium, magnesium, and potassium have all been linked to increased cramping. Interestingly, it has also been found that traveling long distances on foot or in a vehicle can increase your risk of developing a cramp, particularly in your calves. It's hypothesized that prolonged static postures may lead to altered neuromuscular control, which could increase the likelihood of cramping. Now, while a cramp may not seem like a huge deal, it can become dangerous if it happens while you're doing something strenuous. Imagine if you were running a marathon and your leg cramped up. It could potentially cause you to fall, which could lead to catastrophic injuries like a head or neck injury. Alright, now let's move on to our third, shin splints. Shin splints are a common overuse injury that typically occur in runners. They're characterized by pain along the inner edge of your or tibia, and are often accompanied by inflammation of the connective tissue that attaches your muscles to your bones, which is called fascia. A lot of the time, shin splints occur because someone has either increased their mileage or intensity of their running program too quickly, which leads to overuse and tiny micro tears within the muscle fascia. Over time, this can lead to chronic inflammation and persistent pain. Now, as with any overuse injury, if left untreated, it can continue to get worse and eventually shut down the entire musculoskeletal system, preventing you from putting weight on your leg and eventually leading to death. Now, I know this video was all hypothetical, but I hope you can see that it is really important to listen to your body and address issues like Achilles tendon, leg cramps, and shin splints early on. These conditions typically don't cause death directly, but they can certainly cause a lot of pain and suffering, and if left untreated, can snowball into more severe problems. Now, I'd love to hear from you in the comments below. What are some other ways that death might start? Also, if you liked this video, please give it a thumbs up and share it with your friends. Thanks so much for watching. Be sure to subscribe for more content and have a great day. Bye! I'm going to show you where death actually starts from, and it's not your heart. It's actually from your legs. And if you have tight calves or Achilles tendonitis or leg cramps at night, this is for you. Welcome back to the channel, everyone. I am a posturist specialist. And this video is going to be all about the shocking truth about your Achilles tendon and how it affects your whole body, especially your spine and your brain. Now, last time we spoke about the Achilles tendon, I told you about the calf muscles, and soleus, and what they do, and how they attach into that Achilles tendon. And if you haven't seen that video, go watch it first, because it will make sense of this one. So part 2. Let's get started. Okay, so now that you know that the gastroc and soleus muscles attach into the Achilles tendon, you can see here the Achilles tendon right at the bottom of the heel, just behind the heel, right? So when you shorten the Achilles tendon, what happens to the calf muscles? They get put on stretch. So you can see here, my little model has really short calves. This is an extreme example of what happens to someone who has really tight calves. You can see the gastroc and soleus muscle are now in a shortened position. And this is a problem because when you try to lengthen them, it doesn't work. The muscle fibers can't slide past each other. It's almost like trying to stretch a piece of string. You can see here with my model, when I try to stretch it, it just stays the same length. That's because the fibers can't slide past each other. And that's what happens to these two muscles in your lower leg. If they stay in that shortened position for too long, then they stop working. They can't contract anymore. They become paralyzed. Now, this is bad news because you can't walk without those two muscles working. But it gets worse because the tightness in the calf muscles pulls on the back of your heel through that Achilles tendon, which can cause a lot of problems, including Achilles tendon. So why would you want to shorten your Achilles tendon anyway? Well, this is what happens in daily life. When you're sitting for long periods of time with your heels down, you're shortening your Achilles tendon. Or if you're standing up but with your weight in your heels, that also puts a stretch on your Achilles tendon. So you can see when he stands up, my little model has his weight in his heels, and you can see the Achilles tendon starting to lengthen. And when you're standing for a long time or walking for a long time, that can create a problem. But it gets worse because what happens when you're redoing activities that involve repetitive stress on the Achilles tendon, such as running or jumping or dancing, anything where you're stressing that tendon over and over again, you're causing microscopic tears in that Achilles tendon. And that's why people who do a lot of running or jumping or dancing often suffer from Achilles tendonitis, which is painful. And you can see with my model, when he tries to walk, it's very painful. But it gets worse than that because when you start getting tiny tears in your Achilles tendon, it creates inflammation. And that inflammation spreads up the back of your leg, right behind the calf muscles. So it's right there behind the calf muscles, and it starts creating pressure on the nerve that runs down the back of your leg called the sciatic nerve. And the sciatic nerve branches off into all sorts of other nerves that go into your foot and your toes and everywhere else. But when that nerve is compressed, it causes all sorts of problems, including low back pain. So you can see here, when I press on this model's sciatic nerve, you can see he has pain all the way down into his leg. So when that sciatic nerve is being compressed by inflammation from your Achilles tendon, guess what? Your low back hurts. But it gets worse than that because the sciatic nerve also goes into your glute muscles. And when that sciatic nerve is inflamed and it's going into the glute muscles, it causes problems in your pelvis. So your pelvis becomes unstable. And if your pelvis isn't stable, guess what? Your spine isn't stable either. So it starts creating problems all the way up through your torso. You can see this model is completely rounding forward because his pelvis is so loose and unstable. So if your pelvis is unstable, your spine is unstable and you have low back pain. But it gets worse than that because the sacral nerve also goes into your hamstring muscles, which run all the way from your pelvis down into your knee. And when those hamstring muscles are affected by this nerve problem, you can see that the leg is now completely bent. It's called hamstring tightness. So you can see here, my model has really tight hamstrings. And when you have tight hamstrings, guess what? Your spine is completely rounded forward. So when you have tight hamstrings, you can't stand up straight anymore. You're stuck in this forward position. But it gets worse than that because the sciatic nerve also goes into the adductor muscles on the inside of your thigh. And when those muscles are affected, it starts creating more instability in your pelvis. So your pelvis is now completely wobbling all over the place. It's completely unstable! But it gets worse than that because the sciatic nerve also goes into the quads, the large muscle group at the front of your thigh. And when that sciatic nerve is compressed, it starts to affect the function of the quad muscles. So you can see when I'm pressing on this model's quads, he can't extend his knee. The quads are supposed to extend the knee, but he can't do it. He's got knee pain. But it gets worse because when your quads aren't working properly, guess what? You can't walk properly anymore. You might even limp because you're putting all your weight on one leg. But it gets worse than that because when your quads aren't working properly, it starts affecting the stability of your whole leg. And you can see here when I let go of this model's leg, it collapses completely. So he has no control over that leg at all because the quad muscles are so weak. But it gets worse than that because when your quads are affected, it starts creating more problems in your pelvis, making it even more unstable. And finally, it gets worse than that because the sciatic nerve goes into your glute muscles, your butt muscles. And when those muscles are affected, you have what's called glute weakness. And you can see with my model, when I take away his support, his pelvis completely collapses. He can't stand up at all because his butt muscles are weak. So as you can see, when your Achilles tendon is compromised, it creates all sorts of problems. Not just in your lower leg and your foot, but all the way up through your torso into your spine. It can even affect your brain because you might have all sorts of balance problems, dizziness, even double vision. That's how widespread the problems are when you have Achilles tendonitis or tight calves or leg cramps at night. But don't worry, because there is a solution. There's something you can do about this. Now, I can't possibly fit everything into this video. It's already too long. But I can tell you the most important thing, which is you need to lengthen your calves. And I'm going to show you exactly how to do that. It's very simple. All you need is a doorway and a broomstick or anything like that, even a mop handle or anything that you can hold on to. So find yourself a doorway, walk up to it, hold on to the top of the door frame, and lean forward slowly until you feel a big stretch in your calves. Hold that stretch for 30 seconds, breathing deeply and calmly the whole time. And then rest for 30 seconds and then repeat 3 times. Do that 3 times and you will notice your calves instantly start lengthening and relaxing and you won't have that uncomfortable feeling anymore. Now, for the full routine on how to fix this problem, you're going to have to watch my free training on the link below. I can't put it in this video because it's just too long. But when you watch that training, you're going to discover how to lengthen your calves so that you never have this problem ever again. And I'm also going to show you how to do it properly so that it actually works. Because if you just keep doing what you're doing, you're just going to keep getting worse and worse and worse. So please click the link below and watch my free training and then put all this information into practice and notice how your low back starts feeling better and better and better. And if you'd like to ask me a personal question, then book a call with me on my website. I love helping people just like you. So if you're serious about fixing your spine for good, then click the link below and let's talk soon. Hey, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below. 5 silent signs of clogged arteries that you should never ignore, even if you feel fine. The arteries are one of the most important parts of our body, since they carry oxygen-rich blood away from our heart to the rest of our body. Unfortunately, many people have no idea that their arteries are becoming clogged up until it's too late. And even worse, clogged arteries don't always show symptoms. This is why today, I want to share with you 5 silent signs of clogged arteries that you should never ignore, even if you feel fine. Let's dive in! Number 1, jaw, neck, or upper chest discomfort when lying down. When we talk about clogged arteries, many people immediately assume that we're talking about coronary artery disease, which is the blockage of the arteries that supply blood to the heart muscle. But did you know that there are actually different types of clogged arteries? One of the less common but potentially just as serious ones is called thoracic outlet syndrome. This happens when the blood vessels or nerves in the space between your rib cage and your collarbone become compressed. This can cause a variety of uncomfortable symptoms, including jaw, neck, or upper chest discomfort when lying down. Now, it's important to note that this symptom isn't specific to clogged arteries. It could also be related to poor posture, nerve problems, or other issues. However, if you experience this symptom regularly, especially when lying on the same side every time, it may be worth getting checked out to rule out the possibility of a clogged artery or another serious condition. Some research suggests that thoracic outlet syndrome can be effectively treated by improving posture, strengthening the muscles around the shoulder blade, and avoiding activities that aggravate the symptoms. However, it's essential to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan. No. 2. Tearing pain in your shoulder or back. If you often experience a sudden, sharp tearing pain in your shoulder or back, it could be a sign of a condition called aortic aneurysm. An aortic aneurysm occurs when there's a bulge or ballooning in the aorta, which is the main artery that carries blood away from your heart. While aortic aneurysms can often go unnoticed for years, they can become life-threatening if they rupture. In fact, ruptured aortic aneurysms are one of the leading causes of death in the United States. A study published in the Journal of the American College of Cardiology found that the risk of an aortic aneurysm rupturing increases significantly when the aneurysm reaches a certain size. For men, this typically occurs when the aneurysm measures 6.5 centimeters or larger. For women, the threshold is slightly lower at 5.8 centimeters or larger. The good news is that aortic aneurysms can often be treated with medication and lifestyle changes. Surgery may also be an option in some cases. So if you ever experience a sudden tearing pain in your shoulder or back, it's essential to seek medical attention right away. Don't try to tough it out. It could be life-threatening. Number 3, a change in shoe size. Have you ever noticed one of your shoes suddenly becoming tighter than before? It might seem like a trivial matter, but a change in shoe size can actually be a warning sign of something more serious, such as peripheral artery disease. PAD is a condition in which there is a blockage in the arteries that supply blood to the limbs, usually the legs. This can cause symptoms such as cramping, numbness, or weakness in the affected limb. In the early stages of PAD, the symptoms may only occur when you walk, but as the condition progresses, they may become more severe and occur even when you're at rest. One way to diagnose PAD is by measuring the ankle brachial index, or ABI. The ABI is calculated by dividing the blood pressure in the ankle by the blood pressure in the arm. A low ABI score may indicate that there's a blockage in the arteries, restricting blood flow to the feet and ankles, causing swelling and making them feel tight. This could lead to a change in shoe size, making it harder to fit into your old shoes. Research shows that people with peripheral artery disease have a higher risk of cardiovascular events, such as heart attack and stroke. So it's crucial to get treated. Fortunately, lifestyle changes such as eating a healthy diet and exercising regularly can help improve blood flow and reduce the risk of complications. 4. Cold feet or hands. Do your feet or hands feel persistently cold, even when you're in a warm environment? This seemingly odd symptom could be a sign of something more serious, namely poor circulation in your extremities caused by clogged arteries. This condition can not only make your limbs feel uncomfortably chilly, but it can also indicate an increased risk of heart disease, stroke, and other cardiovascular events. Several studies have investigated the relationship between hand and foot coldness and cardiovascular disease. For example, a study published in the journal Clinical Cardiology found that people who reported having cold hands were at an increased risk of developing cardiovascular disease even after adjusting for other risk factors. Another study published in the Journal of the American Heart Association discovered that the coldness of the hands was associated with an increased risk of cardiovascular events, such as heart attacks and strokes. While feeling cold in your hands and feet may be harmless in some cases, it's essential to pay attention to this symptom, especially if it's accompanied by other warning signs such as shortness of breath or chest pain. If you do experience these symptoms, it's important to consult with a healthcare provider to determine the underlying cause and receive appropriate treatment. Remember, it's always better to err on the side of caution when it comes to your health. Number 5. Swollen legs and ankles. Swelling in the legs and ankles is a common problem that can be caused by a number of factors, including standing for long periods, obesity, and pregnancy. However, if you notice that your legs and ankles are swollen, and it doesn't go away after a bit of rest, it could be a sign of a more serious issue, peripheral artery disease. As mentioned earlier, PAD occurs when there's a blockage in the arteries that supply blood to the limbs. This can cause blood to pool in the affected limb, leading to swelling. In addition, clogged arteries can also cause blood to back up in the veins, further contributing to the swelling. The severity of the swelling can vary depending on the amount of blood that is backing up and the amount of time that it been present. Mild swelling may only be noticeable when you stand up after sitting for a long time. However, more severe cases can result in significant edema that may be present all the time. This symptom often occurs in people who have risk factors for cardiovascular disease, such as diabetes, high blood pressure, or a history of smoking. If you notice that your legs and ankles are swollen, and it is not due to a recent injury or pregnancy, it's important to see a doctor to rule out the possibility of PAD or another vascular condition. Early diagnosis and treatment of PAD can help prevent the condition from progressing and causing more serious problems. While there's no cure for PAD, various treatments are available to help improve blood flow and reduce the risk of complications. These include lifestyle changes such as eating a healthy diet and regular exercise, as well as medications and, in some cases, surgery. I know that many people think that clogged arteries only affect older adults or those with risk factors such as diabetes or high blood pressure. However, the truth is that anyone can develop clogged arteries regardless of age or overall health. In fact, studies have shown that clogged arteries are a leading cause of death in the United States, accounting for hundreds of thousands of deaths each year. That S. Why it S. So important to be aware of the warning signs of clogged arteries and to take steps to prevent them from happening in the first place. By making simple lifestyle changes such as eating a balanced diet, exercising regularly, and avoiding tobacco products, you can significantly reduce your risk of developing clogged arteries and keep your arteries nice and clean. Thank you so much for watching. And if you found this video helpful, please don't hesitate to like and share it with your friends and family. We would love to have you back for our next video. Today, we are going to discuss about 7 morning habits that will keep you looking 10 years younger. According to Ayurveda, morning is the time when all the doshas are in balance. It is the best time to do certain things which can have long-term benefits to your health and appearance. These morning habits can make you look younger and healthier. First, drink warm water. When you wake up in the morning, your body gets rid of toxins through urine. But during the night, many toxins also get accumulated in your digestive system. Drinking warm water in the morning will promote blood circulation and help flush out toxins from your body. It helps remove waste products and metabolic byproducts from your body. This will make your skin clear and glowing, and will reduce the chances of getting pimples and redness on the skin. Also, drinking warm water keeps your body well hydrated. Dehydration leads to dry skin, acne, dark eye, circles, and wrinkles. So keep yourself hydrated by drinking enough water during the day and start your day with warm water. Second, oil pulling. Oil pulling is an ancient Ayurvedic technique of cleaning your mouth. You may wonder why oil pulling is good for your oral health. Well, there's a scientific explanation behind this. Certain types of bacteria grow in your mouth. When they grow excessively, they cause bad breath, tooth decay, gum disease, and other oral problems. Oil pulling removes these harmful bacteria from your mouth and reduces the chances of their overgrowth. It has been proven that sesame seed oil is most effective against these bacteria. You just need to take a teaspoonful of sesame seed oil in your mouth, move it around for 10 to 20 seconds, and spit it out. If you want to go for a more natural option, you can also use coconut or olive oil. While there is no harm in keeping it for longer, but the effectiveness will decrease if you keep it for more than 20 seconds. So make oil pulling a part of your morning routine to improve your oral health and give yourself a bright smile. Third, practice. Practice Ujjayi breath. According to Ayurveda, Ujjayi breath calms your mind and rejuvenates your body. It provides calmness to your nervous system and promotes blood circulation. Ujjayi breath increases the amount of oxygen in your body and improves digestion. It also strengthens your immune system and reduces the impact of aging on your body. To practice Ujjayi breath, sit or stand in any meditative posture. Inhale and exhale deeply through your nostrils. You will feel a mild friction at the back of your throat. While practicing this breathing exercise, this friction creates moderate sound while breathing. Practice it for 10 to 15 minutes daily and reap its benefits. Fourth, start your day with lemon. Lemon is rich in vitamin C, citric acid, and other nutrients. It is one of the best ingredients to maintain your health and appearance. The abundance of vitamin C in lemon boosts collagen production. Collagen is an important protein that plays a vital role in maintaining elasticity and firmness of the skin. It is also a very good antioxidant and protects your skin from the damages caused by free radicals. Free radicals are unstable molecules that contribute to aging by causing oxidative stress. So start your day with a glass of lemon juice and water early in the morning on an empty stomach to make your skin healthy and youthful. Fifth, don't forget sunscreen. Sunscreen protects your skin from the harmful effects of UV rays. Overexposure to sun rays causes wrinkles, age spots, and other skin problems. So always apply sunscreen before going out in the sun. There are many types of sunscreens available in the market. Choose a broad-spectrum sunscreen that protects you from both UVA and UVB rays. It should have an SPF of 30 or more. Reapply sunscreen every 2 hours to protect yourself from sun damage. Apart from sunscreen, you can also wear protective clothing, sunglasses, and hats to protect yourself from sun rays. Sixth, eat healthy fats. Healthy fats are essential for your body as they provide you energy and help absorption of nutrients. They are also important for your skin health. Omega-3 fatty acids, vitamin D, and E are some fats which have anti-inflammatory properties. These properties protect your skin from the signs of aging and damage caused by UV rays. Consuming healthy fats regularly will provide you youthful and glowing skin. You can add healthy fats to your diet by consuming avocados, nuts, seeds, and fatty fish. Seventh, yoga asanas. Yoga is not just about meditation and breathing exercises. Asanas, our physical postures, are also important to keep your body flexible and strong. Regular practice of asanas improves blood circulation, strengthens your muscles, and promotes nerve regeneration. It also helps to detoxify your body and improve digestion. Some asanas that can make you look younger are Paschimottanasana, Gomukhasana, Talasana, Bhujangasana, and Virabhadrasana. Paschimottanasana improves blood circulation to your face and nourishes your facial nerves. Chakrasana stretches your face and neck and removes the stiffness in your facial muscles. Gomukhasana reduces fat from your cheeks and double chin area. Talasana tones your thyroid gland and reduces the chances of getting wrinkles on your face. Bhujangasana improves digestion and removes toxins from your body. Virabhadrasana reduces fat from your arms and gives a good shape to them. Practice any of these asanas regularly to get the best results. These are just a few ways to start your day. Incorporate any of these habits into your morning routine, and you will soon see the difference. One reason why people have tingling hands and weak legs is because they not eating enough collagen-rich foods, and even if you are, it might be that your body isn't absorbing enough. So in this video, we going to go over 8 snacks that are high in collagen that you must eat if you want to get rid of tingling hands and weak legs forever. The first snack is bone broth. When you think of soup, what comes to mind? For me, it's my mom making chicken noodle when I was sick or had a cold. But for many other people around the world, their version of comfort soup is bone broth. Bone broth has been used for thousands of years in many different cultures, and for good reason. It's an excellent source of collagen and other nutrients like glycine and glutamine. These amino acids can help reduce inflammation in the body, which may be contributing to your tingling hands or weak legs. Bone broth also contains chondroitin and glucosamine, which are essential for maintaining healthy joints and connective tissues. This can improve mobility and reduce pain and discomfort, which again could be causing your tingling sensations. The second collagen-rich snack is chicken with skin. If you take a look at this chicken leg, you will notice that the dark part of the meat is where all the collagen is. The white meat, on the other hand, is very low in collagen. The third snack is pork rinds. Now, before I continue, I know some of you guys are thinking, well, those are just processed pork skins. They probably don't have any collagen left. Turns out, you couldn't be more wrong. In fact, pork rinds are one of the highest sources of collagen that you can possibly eat. This is because during the processing, they remove most of the fat and leave almost pure collagen behind. However, if you crunch them up into a powder and mix them into smoothies or other recipes, you can easily consume them without any problems. Plus, doing this allows you to absorb all the nutrients, including the collagen. No! 5 is fish with skin. Did you know that fish collagen is actually better than mammal collagen? Fish collagen is made up of smaller collagen molecules called peptides. Peptides are easier for the body to absorb and use, making them an ideal choice for boosting collagen levels. One study found that taking fish collagen peptides improved joint health and reduced pain in older adults. It also enhanced skin elasticity and hydration. Other research shows that consuming fish collagen may help prevent age-related muscle loss. And once again, the skin of the fish is where most of the collagen is. In fact, you can find over 6 grams of collagen in just 3 ounces of cooked salmon skin. And no, salmon skin doesn't taste like regular fish skin. It's delicious, and you should definitely try it. Next up is vegetable glycerin. Glycerin is a clear, odorless liquid that is used in many food products such as ice cream and candy. But did you know that glycerin is also an excellent source of collagen? Glycerin is a byproduct of the rendering process used to make animal fats, and it is often sold as a supplement. Taking glycerin has been shown to improve skin elasticity and hydration, as well as reduce joint pain and inflammation. It can also help with constipation and other digestive issues. Glycerin can be consumed in small amounts through foods such as honey and sugar-free gelatin desserts. However, to get the full range of benefits, it's best to take it as a supplement. Consuming bone and cartilage powder can help improve joint health, reduce pain and inflammation, and even enhance skin elasticity. You can add this powder to smoothies, soups, or other dishes for an extra boost of collagen. Now that you know all the best snacks that contain collagen, let's briefly talk about how you can absorb collagen better. The first thing you need to do is start taking a probiotic. Your gut microbiome plays a huge role in digesting collagen and other proteins. If your gallbladder isn't working properly, then you may have trouble absorbing collagen effectively. Finally, you should really consider taking a digestive enzyme supplement. Digestive enzymes like protease and pepsine help break down protein in the body. By taking these supplements before meals, you can ensure that you are breaking down collagen more efficiently and reducing the chance of it being stored in your joints as gunk. If you enjoyed this video, make sure to subscribe to the channel and turn on notifications. And if you're ready to take your health to the next level by working with me directly, then click the link below to apply for my 101 mentorship program. You will all go through a full evaluation with me to see exactly what you need to do to get rid of tingling hands and weak legs for good. I'll see you guys soon. Welcome to my kitchen. Today we're talking about 4 mistakes that you are probably making when soaking your chia seeds. I am going to talk about what happens when you make those mistakes and what you should be doing instead. And by the way, this is super important because it affects the nutrients in your food. So let's get started! The first mistake that you might be making is adding too much liquid. Now, chia seeds expand when they absorb liquid. That's totally normal. And they can expand up to 27 times their original size. However, if you add too much liquid, more than 3 cups of water for every 2 tablespoons of chia seeds, they're not going to have that nice jelly texture that we want them to have. Instead, they're just going to be kind of like mushy and kind of slimy, not so good. And this is because they absorb too much water, and you wouldn't have enough of those little gel packets inside. It's like the chia seed version of being overwatered. They need the right amount of water to thrive and create those gel packets, which are so good for you. So make sure you're not adding too much water next time you soak your chia seeds. 2 tablespoons of chia seeds, 3 cups of water. You're good to go. The second mistake you might be making when soaking your chia seeds is adding in flavorings too soon. Now, if you're just soaking your chia seeds with water, you're missing out on some amazing flavors. And the truth is, the flavor of your chia pudding or your chia jam or your chia seed egg replacement will depend on the liquid that you use. Now, most people just use water and then they re-surprised when their chia pudding does untaste like anything. Well, there's no flavor in water. But if you add in milk, or cream, or coconut milk, or lemon juice, maple syrup, vanilla extract, almond extract, whatever you like, that's when you can start to develop a lot of flavor. But you do want to wait until after you soak the chia seeds before you add in those flavorings, because what happens when you add them in too soon. The chia seeds are like little sponges, and they're going to absorb all of those wonderful flavors. So by the time you're ready to eat your chia pudding, that flavor is gone. It's all absorbed into the chia seeds, and you've got yourself a tasteless dish again. So add in your flavorings after you soak your chia seeds. The third mistake you might be making is soaking your chia seeds for too long or not soaking them long enough. Now, chia seeds need to soak long enough to activate those little gel packets that we talked about earlier. They need to absorb liquid, and they need to expand. But if you soak them too long, they're going to get soggy and mushy and slimy, and you'll still have that weird texture. Also, chia seeds have these little brown skins around them. And if you soak them long enough, those skins are going to start coming off and getting into your food. So you left with these little squishy things in your chia pudding or your chia jam or whatever it is you're remaking, and it just doesn't look very appetizing. On the other hand, if you don't soak them long enough, they're not going to activate those gel packets. You're not going to get that nice pudding texture that you're looking for. Soaking chia seeds for less than 4 hours is really not going to activate those gel packets enough to give you that desired texture. But soaking them for 8 hours or even overnight is usually just fine. In fact, when I make chia jam, I actually like to soak my chia seeds overnight. When I'm making chia pudding, I like to soak them for at least 4 hours, but not more than 8 hours. And by the way, this doesn't apply to chia sprouts. If you're sprouting chia seeds, you want to be soaking them for only 2 or 3 days. But if you're soaking chia seeds for storage, you want to be soaking them long enough to activate those gel packets and give them the right texture, but not so long that they get soggy and mushy. And finally, the fourth mistake that you might be making is storing your soaked chia seeds wrong. Now, when you soak chia seeds, you reactivating those gel packets and they're going to last in the refrigerator for up to 5 days. But here's what you need to know about storing your soaked chia seeds. First of all, if you're not planning on eating your chia pudding, your chia jam, your chia seed egg replacement, whatever it is you've made with chia seeds, within 5 days, don't bother soaking your chia seeds at all. Just use them dry in your recipes. But if you do plan on eating them within 5 days, you need to store them properly. After you've soaked your chia seeds, I recommend that you put them in an airtight container. Glass is best, but plastic is okay. And you're going to keep them in the refrigerator! Now, some people might tell you to freeze them, but freezing them is going to change the texture and it's going to make them kind of gritty. So I don't recommend freezing them unless you're making chia jam. When you're making chia jam, you actually want to freeze it after you've made it because it's going to give you that nice, smooth, creamy texture that you want in chia jam. But chia pudding, you do not want to freeze it. It's going to make the texture all wrong. So store your soaked chia seeds in an airtight container in the refrigerator for up to 5 days. But here's the thing. After you've soaked your chia seeds, they're going to last for months if you store them properly. So if you're re-soaking your chia seeds and you're re-planning on eating them within a few days, just store them properly in the refrigerator. But if you're not going to eat them within a few days, don't bother soaking them at all. It doesn't make sense. Okay, I hope you enjoyed this video. I hope you learned something new about soaking chia seeds. I hope it helps you make better chia seed recipes. Now, if you're looking for delicious recipes to make with your chia seeds, go check out the links below. I've got some great ones for you. Also, if you're wondering where I get my high-quality organic chia seeds, I've got a link for you below. These guys, they grow their own chia. They don't outsource. They know exactly what's going into their chia seeds. They're non-GMO, they're organic, they're grown right here in the USA, and they're super high quality. So if you're looking for an excuse to start eating more chia seeds, this is it. Go check out my store. We've got some awesome chia seeds for you. Okay, that's it. Have a wonderful day. Bye. Bye. Number 1, eating too much protein. Protein is very important for losing belly fat, but eating too much protein can make things worse. Why? Because the body can only process a certain amount of protein per day. So if you're eating more than that, your body will store the excess protein as fat, especially in your stomach area. This can be problematic because it makes it harder to lose weight. It also causes indigestion, bloating, and water retention. On the other hand, not getting enough protein can lead to muscle loss. That means that when you try to build your abdominal muscles, they won't have anything to attach to, making them smaller and weaker. Instead, focus on getting the right amount of protein. For men, that's around 56 grams per pound of body weight per day. And for women, it's about 44 grams per pound of body weight per day. You can get this from lean sources like chicken breast, fish, and tofu. No? 2. Drinking too much alcohol? Alcohol is full of empty calories, which are easy to overconsume without even realizing it. One drink has about 100 calories. And while that may not sound like a lot, you can easily have several drinks before you realize how many calories you've taken in. Plus, alcohol is processed by the liver before it's released into the bloodstream. But if you're already overweight, your liver may not be able to keep up with all that processing. That means more fat will be stored in your stomach area. In addition to that, alcohol lowers your inhibitions, which can cause you to do things you wouldn't normally do, like eat more junk food or stay up late playing video games instead of going to sleep. All of this can contribute to weight gain, especially around the belly. So, if you want a slim waistline, cut back on the booze. The dietary guidelines for Americans recommend no more than 2 drinks per week for men and 1 drink per week for women. 3. Skipping breakfast. Skipping breakfast may seem like a good way to save time and calories, but it's actually a big mistake. Why? Because when you don't eat breakfast, you're more likely to overeat later in the day. That's because your body is in a fasted state for longer, which raises your ghrelin levels, the hunger hormone. At the same time, it lowers your leptin levels, the satiety hormone. The result is an increased desire to eat more food, especially high-calorie, high-fat foods. In addition, research shows that people who skip breakfast are more likely to be overweight than those who eat breakfast every day. A study published in the American Journal of Clinical Nutrition found that overweight participants who added breakfast to their diet lost more weight than those who did not eat breakfast. So if you want to lose belly fat, make sure you eat breakfast every day. Just be careful what you eat! Don't go for sugary cereals or pastries. Instead, opt for something more filling like oatmeal, Greek yogurt, or eggs. 4. Not getting enough sleep. Sleep is essential for maintaining a healthy weight. When you don't get enough sleep, your body produces more of the stress hormone cortisol. Cortisol tells your body to store more belly fat so you can survive better during stressful situations. That means that if you're not sleeping enough, your body will hold on to more fat, making it harder to lose weight. In addition, sleep deprivation causes changes in the hormones that regulate appetite. As a result, you may feel hungrier and end up eating more calories. Research backs this up. A study published in the journal Obesity found that people who slept less than 7 hours per night were more likely to be overweight than those who got 8 or more hours of sleep. Another study published in the same journal found that sleep deprivation led to an increase in body fat, especially belly fat. To lose your belly fat, aim for at least 7 to 9 hours of quality sleep each night. Make sure to turn off all screens and distractions at least an hour before bedtime. This will help you relax and prepare your body for sleep. 5. Not staying hydrated. Not drinking enough water can lead to dehydration, which can cause your body to retain water and swell up with bloating. That's why it's important to stay hydrated. If you want to lose weight, water helps you feel full, so you're less likely to overeat. In addition, staying hydrated boosts your metabolism because your body uses water to transport nutrients and oxygen throughout the body. Without enough water, your metabolism slows down. Several studies have shown that drinking more water leads to weight loss. For example, a study published in the Journal of Clinical Endocrinology and Metabolism found that drinking 500 milliliters of water before each meal led to an average weight loss of 4 pounds over 3 months. Another study published in the same journal found that drinking more water reduced body fat percentage in overweight men. So, if you want to lose your belly fat, make sure you're staying hydrated. Drink at least 8 cups of water every day. You can add more if you live in a hot climate or work out regularly. 6. Overeating healthy foods. It's important to eat plenty of fruits and vegetables if you want to lose weight. Fruits and veggies are low in calories but high in fiber, which fills you up so you can eat less. However, it's possible to overeat healthy foods. For example, avocados and nuts are healthy, but they're also calorie-dense, meaning they're high in calories per ounce. If you eat too much of them, you can easily overeat and gain weight. In addition, some fruits are high in sugar. For example, bananas and mangoes contain more sugar than strawberries and blueberries. That means that if you eat too many bananas and mangoes, you could be consuming more sugar than you realize. So, if you want to lose your belly fat, focus on eating the right amount of healthy foods. Eat plenty of non-starchy vegetables like broccoli, spinach, and kale. Also, choose fruits that are lower in sugar, such as berries and apples. 7. Eating too many carbohydrates. Carbohydrates are the main source of energy for your body, but eating too many carbs can cause you to gain weight, especially in your stomach area. Why? Because carbohydrates are converted into sugar, which is stored as fat. In addition, carbohydrates raise insulin levels, which can cause you to gain weight. Eating too many carbs can also lead to a decrease in leptin levels, which makes you feel hungry and can cause you to overeat. To lose your belly fat, limit your carbohydrate intake to 250 grams or less per day. You can do this by avoiding bread, pasta, and rice. Instead, eat plenty of non-starchy vegetables, fruits, and whole grains. 8. Not lifting weights. When you lift weights, your body produces testosterone and growth hormone, both of which help you burn fat. In addition, building muscle mass helps boost your resting metabolism, so you can eat more food without gaining weight. Unfortunately, Most people don't lift weights regularly. Only about 20% of adults engage in strength training exercises twice or more per week. If you want to lose your belly fat, make sure you're lifting weights at least twice per week. Focus on compound exercises like squats, deadlifts, and bench presses. These target multiple muscle groups, helping you build muscle mass and burn more calories. 9. Lack of physical activity. Most people think that dieting is the most important thing when it comes to losing weight, but that's not true. In fact, research shows that physical activity has an even bigger impact on weight loss. A study published in the New England Journal of Medicine found that people who lost weight through exercise kept more of it off than those who lost weight through dieting. Exercise also helps reduce the risk of health problems associated with obesity. So if you want to lose your belly fat, make sure you're getting regular exercise. Aim for at least 150 minutes of moderate intensity cardio per week. In addition, lift weights at least twice a week. 10. Not being patient. Losing weight takes time. There is no quick fix or magic pill that will help you shed pounds in a matter of days. If you're not patient, you may give up on your diet and weight loss goals before you see results. That's why it's important to set realistic expectations. Aim to lose 1 to 2 pounds per week. This is a healthy and sustainable rate of weight loss. In addition, focus on making gradual lifestyle changes that you can maintain over the long term. Crash diets and extreme workout programs may lead to quick weight loss, but they're not sustainable. Eventually, you'll return to your old habits and gain back the weight. So, if you want to lose your belly fat, be patient. Stick to your diet and workout plan, and don't get discouraged if you don't see results immediately. I know you're eager to get rid of that belly fat, but it's important to take a smart and balanced approach. Don't fall for quick fix solutions. Instead, focus on making sustainable lifestyle changes. That's the key to long-term success. Remember, your body needs essential nutrients to function correctly. That's why it's important to consume a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. These foods provide the nutrients your body needs to stay healthy, while helping you reach your weight loss goals. So, if you want to flatten your belly, take a holistic approach. Eat a balanced diet, stay active, and manage stress. With patience and dedication, you'll achieve your goals. In today's video, we'll be discussing how to lose 20 kilograms in 1 month. It's possible to lose 20 kilograms in 1 month, but it will take a lot of dedication and hard work. But if you follow the tips in this video, you'll be able to reach your goal weight. So let's get started. The first tip is to cut out all the junk food from your diet. This includes processed foods, sugary drinks, and unhealthy fats. These types of foods are high in calories and low in nutrients, which will prevent you from losing weight. Instead, focus on eating whole, unprocessed foods such as fruits, vegetables, lean proteins, and whole grains. Another important tip is to start exercising regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This can include activities such as brisk walking, jogging, swimming, or cycling. Exercise will help you burn calories and reduce fat mass, leading to weight loss. The next step is to drink plenty of water. Drinking water before meals can also help you feel full, which can lead to reduced calorie intake and weight loss. On average, men should drink about 3.7 liters of water per day, while women should drink about 2.7 liters of water per day. However, it is important to note that individual needs may vary based on factors such as activity level and climate. Getting enough sleep is also essential for weight loss. When you don't get enough sleep, your body produces more of the hormone ghrelin, which stimulates appetite and reduces the feeling of fullness. This can lead to overeating and weight gain. Aim for 7 to 9 hours of sleep each night to keep your hormones in check and support your weight loss goals. The next tip is to manage stress effectively. Stress can cause an increase in cortisol levels, which can lead to fat gain, particularly around the belly area. Find healthy ways to manage stress, such as practicing yoga, meditation, or spending time in nature. Another important aspect is to be patient and consistent with your efforts. Losing weight takes time, and it is important not to get discouraged if you do UNC results immediately. Keep following a healthy diet and exercise plan, and you will eventually reach your goal weight. Now let's talk about some additional tips that can help you lose weight effectively. First, try to eat mindfully. Pay attention to your body's hunger and fullness cues and avoid distractions while eating, such as watching TV or on your phone. This can help you prevent overeating. Another tip is to keep a food journal. Writing down what you eat can help you track your calories and make adjustments as needed. It can also help you identify any patterns or triggers for overeating. Next, consider using a calorie tracker app. There are many different apps available that can help you track your calories and macronutrients. This can be a helpful tool for those who need a more detailed approach to weight loss. It's also important to socialize with people who support your weight loss goals. Spend time with friends and family members who encourage you to make healthy choices and lead a healthy lifestyle. If you're finding this video helpful, please don't forget to subscribe and hit the like button. Your support means a lot to us. Alright, let's get back to the topic. Another thing you can do is to set realistic goals for yourself. Set short-term goals that are achievable and gradually work your way up to longer-term goals. This can help you stay motivated and on track. One specific strategy for setting short-term goals is to aim for a weight loss of 0.5 to 1 kilogram per week. This is a healthy and sustainable rate of weight loss and can help you keep the weight off in the long run. To achieve this, you can use the information provided earlier in the video, such as cutting out junk food, exercising regularly, and drinking plenty of water. Here is an example of a weekly plan that you could follow to lose 0.5 to 1 kilogram per week. On weekdays, aim to consume 1,500 to 1,800 calories per day, and on weekends, allow yourself a bit more flexibility with 2,000 calories. Exercise for 30 minutes most days of the week, and track your food intake using a food journal or calorie tracker app. Remember that everyone is different, and some people may need to consume fewer calories than others to lose weight. Adjust your calorie intake accordingly based on your individual needs. It is also important to keep in mind that weight loss is not just about the number on the scale. Focus on improving your overall health and well-being by eating a balanced diet, exercising regularly, and getting enough sleep. Celebrate your non-scale victories, such as increased energy levels, improved mood, and better sleep quality. To help you further on your weight loss journey, here are some additional resources that you can refer to. The National Health Institute website provides evidence-based information and resources on various health topics, including weight loss. The American Heart Association website offers guidelines and tips for maintaining a healthy weight and reducing the risk of heart disease. And the Centers for Disease Control and Prevention website provides information on childhood obesity and resources for parents and educators. Remember, losing weight can have numerous health benefits, such as reducing the risk of heart disease, type 2 diabetes, and certain cancers. By following the tips outlined in this video and being patient with yourself, you can achieve your weight loss goals and improve your overall health and well-being. Alright, now let's move on to the next part of the video. As promised, we'll now be discussing some effective home remedies for weight loss. It is important to note that these remedies are not a substitute for a balanced diet and regular exercise, but they can be helpful additions to your weight loss journey. First, we have chia seeds. Chia seeds are high in fiber, protein, and healthy fats, which can help you feel full and reduce your appetite. They're also rich in antioxidants and nutrients such as calcium, magnesium, and phosphorus. To incorporate chia seeds into your diet, you can add them to smoothies, yogurt, or make chia pudding. Another option is flax seeds. Similar to chia seeds, flax seeds are high in fiber, protein, and healthy fats. They're also a good source of lignans, which are plant compounds that have been shown to have a variety of health benefits, including weight loss. You can sprinkle flax seeds over your cereal or oatmeal, or grind them into a powder and add them to smoothies or baked goods. Apple cider vinegar is another popular home remedy for weight loss. It is believed that the acetic acid in apple cider vinegar can help reduce fat storage and promote weight loss. You can drink apple cider vinegar in a glass of water before meals, or use it in salad dressings or Next, we have turmeric. Turmeric is a spice that's commonly used in Indian cuisine, and it contains a compound that has been shown to have anti-inflammatory and antioxidant properties. Some studies have also shown that curcumin may play a role in weight loss by increasing metabolism and reducing body fat. You can add turmeric to your food while cooking, or make turmeric tea. Another remedy is ginger. Ginger is a root vegetable that's often used for its distinct flavor in cooking, but it also has some unique properties that may aid in weight loss. Gingerol is a bioactive compound found in ginger that has been shown to have anti-inflammatory and antioxidant effects. Some studies suggest that ginger may help with weight loss by reducing inflammation in the body and helping to maintain a healthy weight. You can drink ginger tea or add fresh grated ginger to your stir-fries or soups. Lastly, we have green tea. Green tea is a beverage that's made from unprocessed leaves, and it contains catechins, a type of antioxidant that may help with weight loss. Some studies suggest that green tea may help boost metabolism and increase the number of calories burned. You can drink green tea in moderation as part of your weight loss diet. While these home remedies may be helpful, it's important to remember that they're not a quick fix for weight loss. A balanced diet and regular exercise are still the most important factors for achieving long-term weight loss goals. Thank you for watching this video on how to lose 20 kilograms in 1 month. We hope that the tips and suggestions we've provided will be helpful in your weight loss journey. Remember to consult with a healthcare professional before making any significant changes to your diet or exercise routine. If you enjoyed this video, please don't forget to subscribe and hit the like button. Stay healthy and motivated on your path to achieving your fitness goals. Hey, it's me! You know what? It's been a while since we talked about the spectrum of mood disorders. This is going to be another one in a series of videos that talks about depression, anxiety, and other mood disorders that affect so many people in our community. But today I want to talk specifically about something called stress, right? What is stress? Is it just a part of life, or is there something more to it? And how can we distinguish between normal, everyday stress and when we should actually be concerned about it? Well, let's break it down together. You know, in medicine, we like to think about things in terms of continuums. A lot of times we LLUs a continuum from 0 to 10, or we LLUs a line and mark off points along the way. When we think about stress, most of the time we think about this kind of bell curve distribution. You have a peak here in the middle, with most people being in the center, and then these tails that extend out on both sides. The difference is, on one side, you see these things that are more positive, right? Things like excitement, enthusiasm, inspiration. And on the other side, you see fear, anxiety, and dread. So where do you fall on this continuum? How much stress is good versus bad? Well, according to experts, it's really a matter of degree and duration, right? So, how intense is the stressor, and how long does it last? For example, let's say you're feeling excited for an upcoming trip. That's stressful, but in a good way, right? You might feel a little bit anxious, but it's overall pretty positive. Let's say you gone. Go visit some friends, and maybe you haven't seen them in a while, so you're looking forward to spending some quality time with them. Well, you start making some plans, you book a flight, and then you find out that your mom got sick, so now you're questioning whether you should still go. Well, that can be stressful. You're torn in 2 different directions. But if it only lasts for a few days, then it's probably not going to cause any harm. In fact, sometimes these kinds of stressors can actually motivate us and help us grow. On the other hand, if you had a final exam every single day for a whole year without a break, well, that would definitely take a toll on you, right? That kind of prolonged and chronic stress can make us physically ill and even shorten our lifespan. So although stress isn't necessarily bad, it's all about that balance. So what does the research say about this? Well, studies show that experiencing some stress throughout our lives is actually a good thing. We don't want to live in a bubble wrapped in cotton, right? Some stress is actually necessary to keep us sharp. It keeps us focused, motivated, and it helps us grow. It pushes us outside of our comfort zones and allows us to learn and become stronger. However, when it becomes chronic or prolonged, then that's when we start to experience negative consequences. Now, you might be thinking, okay, great, I understand that. But how do I know if I am experiencing normal amounts of stress or if it is becoming harmful? Well, That's a great question. In general, we can look at 3 different areas: our behaviors, our thoughts, and our body. So let's start with our behaviors. Are they mostly adaptive or maladaptive? Well, adaptive behaviors are things like taking action towards a goal, learning new skills, and facing challenges head-on. Maladaptive behaviors are things like procrastination, avoidance, and self-harm. So if you find yourself mostly doing the latter, then that could be a sign that you're experiencing too much stress. Next is our thoughts. Are they mostly positive and empowering, or negative and Well, positive and empowering thoughts are things like affirmations and positive Negative and self-defeating thoughts are things like negative self-talk, rumination, and cognitive distortions. So if you find yourself mostly having the latter, then that could also be a sign that you're experiencing too much stress. Finally, we have our bodies. Are they mostly balanced and calm, or reactive and Balanced and calm would be things like our heart rate and blood pressure staying relatively low and stable. Reactive and dysregulated would be things like increased muscle tension, insomnia, changes in appetite, and difficulty concentrating. So if you're noticing that your body is mostly in the latter category, then that could be a sign that you're experiencing too much stress. So how do you know if you're experiencing just the right amount of stress? Well, the answer is, it depends. It depends on a number of factors, including the intensity of the stressor and your ability to cope with it. However, here are some general guidelines. If you're constantly feeling overwhelmed, like you're drowning in responsibilities, if you're struggling to function in daily activities, or if you're avoiding social interactions, then it might be time to take a step back and assess the situation. Ask yourself, am I taking on too much? Am I saying yes to everything? Am I procrastinating because I'm afraid of failure? Taking some time to reflect on your situation can help you identify areas where you need to make changes. Maybe it's time to delegate tasks, seek support from others, or set healthy boundaries. Remember, it's not a sign of weakness to ask for help. In fact, it's a sign of strength. Another important factor is your perception of the stressor. How you view a situation can have a big impact on how you respond to it. For example, let's say you're giving a presentation at work. Some people might feel excited and motivated by the challenge, while others might feel anxious and stressed out. Your attitude and mindset can play a big role in how you experience stress. If you're able to reframe negative thoughts and focus on the positive aspects of a situation, you'll be better equipped to handle it effectively. It's also important to consider your support system. Do you have a strong network of friends, family, and colleagues who can offer emotional support and practical assistance when you need it? Having a solid support system can make a big difference in how you cope with stress. Don't hesitate to reach out to your loved ones when you're feeling overwhelmed. They can provide valuable perspective, helpful suggestions, and a listening ear. And finally, don't forget to take care of your physical health. When you're under stress, it's easy to neglect self-care, but that can make things worse. Make sure to get enough sleep, eat nutritious foods, and exercise regularly. These basic self-care practices can help you build resilience and manage stress more effectively. If you've made it this far, I appreciate you sticking with me. This stuff is so important to talk about. Please share this video with someone you care about if you think it will help them. It takes very little effort on your part, and it helps spread awareness about these important topics. Also, if you want to continue learning about mental health and psychology, I've got a bunch more videos right here for you to check out. Again, thanks so much for watching. Take care, and I'll see you next time. I know that for many of you watching this video, alcohol is an important part of your life. It may be something that you enjoy with friends, maybe something you do to relax after a long day or a long week, and in some cultures, it's just a normal part of daily life. Well, today we're going to talk about what alcohol does to your body, and this includes both short-term and long-term effects. So whether you drink occasionally or regularly, there are some things that you should know about how alcohol affects your body. Hey guys, welcome to our channel. Today, we'll be talking about 10 things that alcohol does to your body. But before we get started, make sure to subscribe so you don't miss out on future videos. And if you find this video helpful, please like and share it with others. That would be much appreciated. Let's begin. Number 1. Dehydration. The most immediate effect of drinking alcohol is dehydration. Alcohol is a diuretic, which means that it increases urine production. This can lead to dehydration rather quickly, especially if you're not replacing the fluids you lose by drinking water or other non-alcoholic beverages. This is why it's important to stay hydrated when you're drinking alcohol. Otherwise, you may end up feeling thirsty, having a headache, or even passing out from dehydration. No. 2. Lowered inhibition. Another well-known effect of alcohol is that it lowers your inhibition. This is because alcohol affects the part of the brain that is responsible for decision-making and social norms. As a result, you may say or do things that you normally wouldn't while under the influence of alcohol. You may feel less shy or inhibited in social situations. And some people may become more emotional or even burst into tears. Others may become aggressive or start fights. No. 3. Hangovers. Unfortunately, the fun night out with friends often ends with a hangover the next day. A hangover is your body's way of reacting to the toxic effects of alcohol. Symptoms include headache, nausea, fatigue, and difficulty concentrating. The severity of a hangover can vary depending on how much alcohol you consumed and how long you were drinking for. Some people are more prone to getting hangovers than others. And unfortunately, there is no cure for a hangover. The best thing to do is to rest and drink plenty of water. Some people swear by certain hangover cures such as eating a banana or drinking coffee, but there is no scientific evidence to support these claims. Number 4, increased risk of accidents. As we all know, drinking and driving is a major cause of accidents. Alcohol impairs your judgment and reaction time, which can lead to dangerous decisions on the road. This is why it's important to never drink and drive. If you're going to be drinking, make sure to have a designated driver or call a taxi or a ride-sharing service. In addition to drunk driving accidents, alcohol also increases the risk of other types of accidents, such as falls. When you're under the influence, you may lose your balance and fall, which can lead to serious injuries. No. 5. Weight gain. If you're trying to lose weight, drinking alcohol is probably not the best idea. Alcohol is high in calories, and it's easy to overindulge without realizing it. In addition, alcohol can cause you to eat more food, even if it's not food that you normally eat when you're sober. This is because alcohol affects your judgment and makes you less likely to stick to your diet. No. 6. Liver damage. Your liver is responsible for filtering toxins out of your blood, and alcohol is one of the most common causes of liver damage. When you drink alcohol, your liver breaks it down into small amounts of a substance called acetaldehyde is toxic and can damage cells in your liver. Over time, this damage can lead to inflammation and scarring of the liver, which is known as cirrhosis. Cirrhosis can lead to more serious problems, such as liver cancer. If you're concerned about the health of your liver, talk to your doctor about getting a liver function test. No. 7. Heart disease. Drinking alcohol in moderation may not be as bad for your heart as you might think. However, heavy drinking or binge drinking can lead to several heart problems. Alcohol can raise blood pressure and increase the risk of stroke. It can also cause cardiomyopathy, a disease that makes it harder for your heart to pump blood. This can lead to heart failure. Finally, alcohol can contribute to irregular heartbeat. All of these problems can increase your risk of having a heart attack or stroke. No. 8. The pancreas is an organ that produces enzymes to help you digest food. When these enzymes are released into the bloodstream, they can cause inflammation of the pancreas, which is called pancreatitis. This can be very painful and can lead to hospitalization. Alcohol is one of the most common causes of pancreatitis. In fact, 70% of people who have chronic pancreatitis did so because of their drinking habits. No. 9. Mental health problems. Drinking alcohol can worsen existing mental health problems. This includes depression, anxiety, and post-traumatic stress disorder. Alcohol is also associated with the development of other mental health problems, such as dementia. Dementia is a decline in mental ability that makes it difficult to perform everyday tasks. One of the most common causes of dementia is Alzheimer's disease. And studies have shown that drinking alcohol is associated with an increased risk of developing Alzheimer's disease. 10. Cancer. According to the American Cancer Society, there is convincing evidence that drinking alcohol causes cancer. This includes breast cancer, colorectal cancer, esophageal cancer, liver cancer, oral cancer, pharyngeal cancer, laryngeal cancer, and throat cancer. The more alcohol you consume, the higher your risk of developing these cancers. Conclusion: whether you choose to drink alcohol is a personal decision. However, it's important to be aware of the potential risks involved. Now that you know what alcohol does to your body, you can decide whether or not it's worth it. Of course, if you want to continue drinking, we recommend doing so in moderation. This means having no more than 2 drinks per day if you're a man, and no more than 1 drink per day if you're a woman. If you do choose to drink, please do so responsibly. Never drink and drive, and be careful not to overindulge. Hopefully this video was helpful and informative. If you have any questions or concerns, please comment below and we'll do our best to answer them. Again, thanks for watching and take care. Hi everyone, it's me. Today we are going to talk about 3 big ideas that will change your relationship with money forever. These are all things that I wish I had known much sooner, because they would have saved me a lot of trouble and heartache. So let's jump into it. The first idea is that money isn't everything. This may seem obvious at first, but when you think about it deeper, this can be a really profound concept. And I think sometimes we lose sight of this, especially if you like me and you work in finance, or you work with businesses that are trying to grow their revenue or increase their profit margins. All of these things require money. And we can become so focused on generating more revenue, increasing our profit margins, that it's easy to forget that money is just a tool. Money is not an end in itself. And so, it's important to keep that in mind. You wouldn't want to become so fixated on making more money that you lose sight of what really matters in life. If money was everything, then someone who's incredibly wealthy but has no friends, no family, no one who loves them could be considered the luckiest person in the world. But we know that's not true. We know that there's more to life than just having lots of money. So I think it's important to take a step back and look at the bigger picture and remember that money is just a tool. It's not an end in itself. So what do you want to use your money for? What kind of impact do you want to make in the world? What kind of legacy do you want to leave behind? These are the questions that I think are far more important than simply how much money can I make or how much money can I save. No! 2, and this is a big one, is that you shouldn't compare yourself to others. It's really easy in today's world to compare ourselves to others. We see people flaunting their wealth on social media, and it can be really tempting to want to keep up with the Joneses. But doing this is a surefire way to unhappiness. The reality is that everyone's financial situation is different. We all have different incomes, different expenses, different goals, and so it just doesn't make sense to compare ourselves to others. Everyone's journey is different, and we all have different challenges to overcome. When we compare ourselves to others, we're setting ourselves up for failure, because we constantly going to feel like we're falling short. Even if we achieve something, there's always going to be someone else who has achieved more. So why even bother comparing? I think it's important to remember that everyone's journey is different, and we should focus on our own path, rather than comparing ourselves to others. This is also really important for our mental health. When we compare ourselves to others, we're often focusing on what we don't have or what we haven't achieved yet. This can lead to feelings of envy, resentment, and jealousy. Not only does this make us feel bad about ourselves, but it also destroys our relationships with the people around us. Envy and jealousy are not positive emotions, and they're certainly not conducive to building strong relationships. I think we should celebrate the success of others and be happy for them. When someone else succeeds, it doesn't take away from our own success. In fact, it inspires us to do better and to strive for excellence. Let's focus on our own journey and be happy for the journey that other people are on. All right? The last idea is that you should stop buying things that you don't need. This may seem like common sense, but trust me, we all do this way too much. It's really easy to buy things that we don't need. With just a few clicks of a button, we can have anything we want delivered to our doorstep in a matter of days. But this is a recipe for financial disaster. When we buy things that we don't need, we're wasting our money and we're also wasting our time. Time is our most precious resource, and when we spend our time acquiring things that we do not need, we're taking time away from things that really matter. So how do we break the cycle of buying things that we don't need? Well, the first step is to be aware of it. We need to be aware of our spending habits and the motivations behind why we buy things. Are we buying things because we actually need them? Or are we buying things because we feel like we need them? There's a big difference between the two. Once we're aware of our spending habits, we can start to change them. This takes time and effort, but it's definitely possible. We need to start by setting some financial goals. What are we saving up for? A down payment on a house? A new car? Retirement? Once we have our goals in mind, we can start to develop a budget that will help us reach those goals. This doesn't mean that we have to cut back on all of our spending, but we do need to be mindful of our spending and make sure that it is in line with our goals. One way to do this is to use a budgeting app. There are a lot of great ones out there that can help you track your spending and create a budget. Another thing that we can do is to start saving a portion of our income every month. This doesn't have to be a huge amount, but even a small amount can add up over time. If you're able to save $50 a month, that's $600 a year. And if you're able to save $100 a month, that's $1,200 a year. That's a lot of money. I think it's really important to have a plan for our money. Where's our money going? Are we spending it on things that align with our values and our goals? Or are we just letting it slip through our fingers? We want to make sure that our money is working for us and not against us. So there you have it. 3 big ideas that will change your relationship with money forever. By the way, if you want to learn more about personal finance, check out the link in the description below. We've got tons of free resources that can help you get on the path to financial freedom. Thank you so much for watching. Until next time. Hey guys! Hello! Welcome back to my channel. If you're new here, welcome! And today's topic is one of my favorites because it's all about our guts. It's all about food for 5 things you need to know in order for you to have better gut health. But it asks, actually, 5 foods that you need to add or maybe avoid in order for you to achieve better gut health. So let's get right into it. Number 1, prebiotics. What are They are types of fiber that we cannot digest. We don't have the enzymes to break them down. This is why they're called undigested fibers, okay? But the bacteria, the good bacteria in our gut, can feed on these So the best sources of prebiotics are bananas, asparagus, artichokes, onions, garlic, leek. These are all fantastic prebiotic foods. But what happens when we consume prebiotics? Why are they important? Because first of all, they increase the number of good bacteria in our gut. So they will help us with a healthy immune system. They will make us feel full. They will prevent us from being constipated and having to go through a process called lavage, which is uncomfortable. They will help us lose weight because they feed the good bacteria. And there is actually studies that shows that people who consume more prebiotics have less inflammation. And therefore, less risk in getting inflammatory bowel disease like Crohn's and ulcerative colitis. So definitely load up on prebiotics. No! 2 is probiotics. Probiotics are live bacteria, okay? That when consumed in adequate amounts will confer a health benefit to the host. Okay, so we're talking about you. So what does this mean? This means that if you eat fermented foods that contain probiotics, it will introduce live bacteria into your body, into your digestive system. And if those bacteria are beneficial bacteria, they will have a positive effect on your health. You might be asking yourself at this point, well, geez, I already have enough bacteria in my gut. I mean, do I really need to take them in through food? The answer is yes. Number 1, because we lose bacteria every single day just by living. So we're constantly losing bacteria and we need to replenish them. No. 2, not all bacteria are created equal. Okay, so even though we have billions and billions of bacteria in our gut, they're not all the same type of bacteria. So, by introducing new bacteria, which are usually beneficial bacteria, you're going to have a positive effect on your health. So, how do we get probiotics? Fermented foods like yogurt, kimchi, kefir, miso, kombucha, sauerkraut, tempanado. And if you don't like any of these foods, no worries. You can always take a probiotic as a supplement. No. 3 is polyphenols. Polyphenols are plant compounds that have a lot of health benefits. Okay, they have anti-inflammatory properties. They can fight free radicals in the body. And guess what? They also act as food for our good bacteria, our microbiome. So basically, if we want to keep our good bacteria happy, then we need to feed them polyphenols. What foods are rich in polyphenols? Well, dark chocolate, green tea, blueberries, cranberries, oranges, apples, strawberries, raspberries, blackberries. You see a pattern here? Basically, most fruits and vegetables are loaded with polyphenols, and so are whole grains and legumes. Now, since polyphenols are considered phytochemicals, meaning they come from plants, we don't really need them necessarily in our diet, but they definitely have a lot of health benefits. So the more the merrier. Now, number 4 is fiber. Fiber is actually a prebiotic, but I wanted to mention it here because fiber has a lot of benefits. It's not just a food for our bacteria, but it helps us with so many things. It helps us to feel full, helps us with weight loss, prevents constipation, and helps to improve our digestion. So what foods are high in fiber? Well, we talked about prebiotics. So asparagus, bananas, artichokes, onions, garlic, leeks. All these foods are high in fiber. Whole grains are high in fiber. Legumes are high in fiber. Fruits and vegetables are high in fiber. Nuts and seeds are high in fiber. So definitely try to include a variety of high fiber foods in your diet. No. 5, this is probably the most important one. And it is actually something that you should avoid, and that is refined carbohydrates. Refined carbohydrates are one of the worst things that you can possibly put into your body because they do not have fiber. They're not only devoid of nutrients, but they cause a lot of damage to our bodies, especially to our gut. And refined carbohydrates would be white rice, white flour, bread, pasta, pizza, cereal, milk, soda, juice, donuts, cookies, crackers, basically anything that's made out of refined flour or has added sugar. So this is probably the easiest thing that you can do in order to improve your gut health. Just avoid these foods. By avoiding refined carbohydrates, you're going to reduce the risk of developing leaky gut syndrome, which is a very serious condition where our intestines become damaged and start to leak toxins into our bloodstream. And this can cause a lot of autoimmune conditions. We also know that eating too many refined carbs will increase our risk of developing inflammatory bowel disease, which is Crohn's disease and ulcerative colitis. It will increase our risk of developing colorectal cancer, colon cancer. It also disrupts our circadian rhythm, meaning our internal clock, and messes up our sleep patterns. So if you want to have better gut health, start by cutting out or reducing refined carbohydrates. Now, of course, these 5 things are just the tip of the iceberg. When it comes to improving your gut health, there's so much more that goes into it. And in fact, I have an entire online course called The Complete Guide to Healing Your Gut. It's 6 modules, 8 hours of in-depth gut health information that will teach you absolutely everything about your gut. How to heal it, what foods to eat, what foods to avoid. I go over supplements. I go over the microbiome. I go over testing. It's just an amazing course. And you can get it on my website. So in the meantime, here are some other videos that I think you might enjoy. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already if you didn't do it. And if you did, watch this video right there. I think that will help you too. Hey there! Have you ever had a situation where you go to bed at a decent hour, sleep for 8 hours, wake up, still feeling tired and think, I didn't get my steps in yesterday, even though you were sedentary all day. You didn't do anything particularly strenuous, and you wonder, how come I feel so tired? In this video, we're going to explore why that happens. Hi there! I'm a doctor! I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is created to help answer some of your medical questions and the questions that are commonly asked by patients. If you find this video helpful, please do me a favor and subscribe. So let us talk about why you might be having a situation where you have a normal amount of sleep, but still feel tired. The first thing I want to rule out is if you actually slept for 8 hours. It's not quite as easy as just going to bed and waking up. If you go to bed at 10 p.m. and wake up at 6 a.m., that's 8 hours of sleep. But what if you spent 2 of those 8 hours kicking and screaming, thrashing around, and your body is still in fight or flight mode? Those aren't good quality sleep hours. In order for you to get a full night's rest, you need 4 distinct stages of sleep. Stage 1, Stage 2, Stage 3, and then REM sleep. Your body cycles through these stages every 90 minutes, and you can complete 4 to 5 cycles a night. Stage 1 is when you're drifting off to sleep, you're easily awakened. Stage 2 is when your heart rate slows down, your breathing becomes more regular, your muscles relax. This is a good part of sleep. Stage 3 is also called deep sleep. This is when your body repairs tissue, synthesizes proteins, restores energy. This is very restorative sleep. This is when growth hormone is released. So if you're an athlete or you're trying to build muscle, you really want to make sure you get good, deep sleep. And then finally, REM sleep, which is rapid eye movement sleep. This is when you start dreaming. And this is very important for brain function. So if you get interrupted sleep or you just not spend enough time in each of these stages, you're not going to feel refreshed. A few things that can interrupt your sleep include having a roommate that keeps you up, having loud noises throughout the night, your pet, your kids, whatever it might be. All of those things can keep you in light sleep and not allow you to progress through the different sleep cycles. The next reason you might not be getting good quality sleep, despite being in bed for 8 hours, is because of medical conditions. There's many different medical conditions that can cause you to have poor sleep quality or prevent you from getting a full night's rest. The most common ones include sleep apnea, restless leg syndrome, and periodic limb movement disorder. With sleep apnea, people will stop breathing multiple times throughout the night. With restless leg syndrome, you have an urge to move your legs, often accompanied with uncomfortable sensations. Periodic limb movement disorder is where you have involuntary kicking of the legs while you're asleep. Other causes of poor sleep can include chronic pain, acid reflux, gastrointestinal problems like irritable bowel disease, anxiety, depression, and post-traumatic stress disorder. Also, allergies and asthma can cause you to not get a restful sleep. Next, you could be taking certain medications that can affect your sleep. Some of these medications include antidepressants, stimulants like Adderall, corticosteroids, and blood pressure medications. And last, caffeine and alcohol can also affect your sleep. Now, I know many of you are thinking, well, I drink a couple cups of coffee a day and I have no problem sleeping. But what you're probably doing is compensating. You're going to bed earlier, you're staying in bed longer, and even if you're not doing that, you might be getting a better quality sleep despite drinking that coffee. But everyone compensates differently. So what can you do if you reach someone who has poor sleep quality, or you've gone to bed early, you've stayed in bed longer, and you're still not getting your sleep in? 1. Start keeping a sleep journal. Keeping track of when you go to bed, how long you stay in bed, and how many interruptions you have can help you identify patterns and pinpoint exactly what might be causing the interruptions. So if you have a roommate, maybe they're coming in late, you can address that. If you're finding you have a lot of interruptions due to having to use the bathroom, maybe that's something else you can address. But keeping a sleep journal can be really helpful. 2. Try and maintain a consistent sleep schedule. Try going to bed at the same time every night and waking up at the same time every morning. Now, I know on the weekends you might want to sleep in, but try to limit that extra sleep to 1 hour max. You don't want to sleep in any longer than that, because it can make it harder to get up the next day and get back on your sleep cycle. Next, make sure your bedroom is dark, quiet, cool, and well ventilated. If you're struggling with sleep apnea, you may need to consider using a CPAP machine. If you're struggling with restless leg syndrome or periodic limb movement disorder, there's a number of medications that can be helpful for that. So definitely work with your primary care doctor to figure out the best treatment plan for you. Next, avoid napping. Now, I know this sounds counterintuitive. If you're tired, you should take a nap, right? But if you take a nap, even a 20-minute nap, it can make it harder to get good quality sleep that night. And especially if you take a nap later in the day, you can throw off your whole sleep cycle. Another thing you can do is exercise regularly, but not too close to bedtime. Exercise can promote better sleep. However, exercising too close to bedtime can stimulate you and make it harder to fall asleep. So try to finish your workout about 2 hours before bedtime. And lastly, limit screen time. The blue light emitted from cell phones and other electronic devices can make it harder to fall asleep. Try reading a book instead. If you're struggling with falling asleep, you can try things like counting sheep, but that doesn't always work. There are also apps that you can download that can play white noise or nature sounds that can be helpful. Lastly, if you're struggling with insomnia or poor sleep quality, you can see a sleep specialist. A sleep specialist can help you with things like a sleep study if appropriate. They can look at your environment and see if there is anything in your environment that might be contributing to poor sleep. They can help you with your sleep hygiene and really work with you to try to optimize your sleep. Alright, hopefully this was helpful. Please do me a favor and subscribe. Also, I want to hear from you. Have you ever had a situation where you slept for a long time but still felt tired? What did you do to improve your sleep? Comment below. I'd love to hear from you. Thanks again for watching. Take care! Heart attack is one of the most common nowadays. There are many reasons for heart attacks. In fact, there are more than 500 types of heart attacks. But in this video, we are going to discuss about the 3 common causes of heart attacks. So if you want to know what are the 3 common causes of heart attacks, watch this video till the end. And also share this video with your family and friends because it might help them. Common symptoms of heart attack are chest pain, discomfort, shortness of breath, nausea, sweating, and lightheadedness. Also, some people don't show any symptoms at all. And by the time they come to know about their heart attack, it is too late. That's why it is very important to know about the causes of heart attack. And once you know the cause, you can avoid that and prevent yourself from having a heart attack. First reason for heart attack is high blood pressure. High blood pressure is one of the leading causes of heart attack. In fact, 75% of all heart attacks happen because of high blood pressure. Blood pressure rises when the arteries get narrower. This makes the heart work harder, and over time, it weakens the arteries. High blood pressure can also damage the blood vessels in other parts of the body, such as in the kidneys. When the kidneys get damaged, they leak protein in urine. So if you see protein in urine or you have difficulty in urination, this could be a sign of high blood pressure. High blood pressure doesn't cause any symptoms until it has done some damage. So you should check your blood pressure regularly. Normal blood pressure is considered to be 120 over 80 millimeters of mercury. If your blood pressure is more than 140 over 90 millimeters of mercury, then it is called hypertension. If your blood pressure is very high, then you should immediately consult your doctor. Second reason for heart attack is coronary artery disease. Coronary artery disease is another leading cause of heart attacks. In coronary artery disease, the arteries which supply blood to the heart get narrowed. This happens because of the deposition of fat, cholesterol, and calcium in the arteries. As the arteries become narrower, the supply of oxygen to the heart becomes less. And when the supply of oxygen is less, the heart does not function properly, and this leads to heart attack. The coronary artery disease is caused by diabetes, high blood pressure, and high cholesterol. So, to prevent coronary artery disease, control your diabetes, control your blood pressure, and reduce your cholesterol. You should also avoid smoking and alcohol. You should do regular exercises and eat healthy food. If you do all these things, then you can reduce the risk of coronary artery disease. Common symptoms of coronary artery disease are chest pain, especially when you are doing some physical activity. Other symptoms include shortness of breath, nausea, and lightheadedness. If you experience any of these symptoms, consult your doctor immediately. Third reason for heart attack is atrial fibrillation. Atrial fibrillation means the upper part of the heart is not beating properly. Normally the heart beats in a regular rhythm, but in atrial fibrillation, the rhythm is irregular and the heart beats very fast. This can cause blood clots in the heart. These blood clots can go to the brain and block the arteries in the brain. This will cause stroke. Atrial fibrillation can also cause heart failure. In atrial fibrillation, the heart cannot pump blood properly. Because of this, the blood starts leaking out of the blood vessels, and this leads to edema. In this condition, you will have fluid retention, especially in your legs. So if you have swelling in your legs, this could be a sign of atrial fibrillation is caused by high blood pressure, diabetes, coronary artery disease, and sleep apnea. Atrial fibrillation can be treated with medicines such as amiodarone, flecainide, and dronedarone can restore the normal heart rhythm. There are also some side effects of these medicines, so consult your doctor before taking these medicines. Other than medicines, you can also do cardioversion. It is a procedure in which the heart is made to beat in a normal rhythm by passing electric shocks. If your atrial fibrillation is long-term, you may need a pacemaker. Other than these three reasons, there are many other causes of heart attack. Let us discuss about them. One of the cause is age. Age is one of the most common factors for heart disease. The risk of heart disease increases as you grow old. The risk increases rapidly after the age of 65. Gender is also an important factor. Men are at higher risk of heart disease as compared to women. But after the age of 55, women are equally at risk. Family history is also an important factor. If someone in your family has had heart disease, then you are at higher risk. You should consult your doctor and ask about the risk of heart disease. Your doctor will tell you, according to your family history. People with diabetes and low vitamin D levels are also at higher risk of heart disease. Also, obesity and lack of physical exercise increase the risk of heart disease. Now let us discuss how we can prevent heart attack. First, stop smoking. Smoking damages the arteries and increases the risk of heart attack. So quit smoking if you want to protect yourself from heart attack. Second, control your blood pressure. High blood pressure is one of the major causes of heart attack. So keep checking your blood pressure regularly. If you have high blood pressure, consult your doctor. Third, reduce your cholesterol. High cholesterol also increases the risk of heart attack, so you should get your cholesterol checked regularly. Fourth, control your diabetes. Diabetes increases the risk of heart attack, so keep your sugar levels under control. Fifth, be physically active. If you are not physically active, then there are more chances of getting heart attack. Do some exercises like walking, jogging, swimming, etc. Sixth, maintain a healthy diet. Eat fruits, vegetables, whole grains, and lean proteins. Reduce the intake of saturated and trans fats. Saturated and trans fats increase the level of bad cholesterol. This increases the risk of heart attack. So avoid these fats. Seventh, limit alcohol intake. Drinking too much alcohol can increase your blood pressure. This raises the risk of heart attack. So drink alcohol in limits. Eighth, maintain a healthy weight. Obesity increases the risk of heart attack, so you should maintain a healthy weight. Ninth, get enough sleep. Sleep deprivation increases the risk of heart attack, so sleep well. And 10th, manage stress. Stress increases the risk of heart attack, so find some ways to manage stress, such as meditation, yoga, deep breathing exercises, etc. In the end, I would just like to say that heart attack is one of the most common diseases nowadays. But you can prevent it by making some changes in your lifestyle. Just follow all the things which I have told you in this video, and I promise you, you will never get heart attack in your life. So, take care! Stay healthy! Have you ever wondered why your legs feel like they are being pulled and twisted all night long? If so, then this video is for you. Keep watching to find out what causes leg cramps at night and what you can do about it. Muscle cramps at nighttime are known medically as nocturnal leg cramps. They're painful, involuntary muscle contractions that typically occur in the lower legs, although they can also affect the arms and other body parts. The affected muscles may feel tight and hard, and the pain can vary from mild to severe. The cramps often resolve by themselves within a few seconds or minutes, but they can persist for hours in some cases. These cramps are usually felt in the calf muscles, which are located in the lower part of the leg below the knee. But again, they can be felt in different parts of the leg, the foot, or even the arms and hands. Nocturnal leg cramps tend to occur during the first third of the night, most commonly between 8 p.m. and 4 a.m. This condition usually affects adults over the age of 60, but it can affect people of any age. Although these cramps don't usually pose serious health risks, they can cause significant discomfort and distress. And here's the thing! They are completely normal! However, if you have frequent episodes of leg cramps at night, especially if they interfere with your sleep, keep watching. Because in this video, we will share some of the top medical causes of leg cramps at night in seniors or young age, plus an easy step-by-step guide on what to do about it. So make sure to watch till the end. Also, if you're new here, don't forget to hit that subscribe button to stay updated with our health-related videos. Let's begin! First of all, let's start with the most common medical causes of leg cramps at night. One of the most frequent causes of leg cramps at night is dehydration. When you're dehydrated, your body can become unbalanced, and this can lead to muscle cramps. Drinking plenty of fluids throughout the day, especially water, can help prevent cramps caused by dehydration. It is important to pay attention to the amount of urine you produce. If you notice that your urine is pale or you haven't been urinating frequently, you should drink some water right away. Also, you should avoid drinking caffeinated drinks like coffee, tea, soda, juice, and alcoholic drinks because they can dehydrate your body further. It is advisable to drink about 8 glasses of water daily to maintain proper hydration levels. Another medical cause of nocturnal leg cramps is low levels of calcium, potassium, magnesium, or sodium in the blood. Your body needs a good balance of electrolytes to function correctly. Electrolytes are minerals that carry an electric charge when dissolved in fluids like blood. They help regulate many important functions, such as muscle contraction and nerve impulse transmission. You see, when the levels of these vital minerals are not balanced, it can disrupt nerve and muscle function, leading to cramps. For example, low levels of calcium or potassium in your blood are linked to leg cramps. In fact, studies show that most athletes who experience leg cramps have low levels of calcium in their blood. Calcium helps regulate muscle contraction and nerve impulses. Therefore, a deficiency in this mineral can cause muscles to contract uncontrollably, leading to painful cramps. Similarly, low levels of potassium in your blood can also cause muscle weakness and cramps. Potassium is an essential nutrient that helps balance fluid levels in your body and regulates muscle contractions. Other common medical conditions that can cause leg cramps at night include chronic kidney disease, thyroid disorders, diabetes, and liver disease. Each of these conditions can affect the way your body processes electrolytes, leading to imbalances that trigger cramps. Plus, sleep apnea, a condition where breathing repeatedly stops and starts during sleep, has also been associated with leg cramps. It happens because people with sleep apnea have low levels of oxygen in their blood, which can cause muscles to cramp. Now, if you want to know whether you have any electrolyte imbalances, we recommend that you take a blood test. Now, let's talk about another big reason behind nocturnal leg cramps. Poor blood flow. As we get older, our arteries can become hardened and narrowed, which reduces the flow of blood to our muscles. This can cause them to become weak and more prone to cramping. People with peripheral arterial disease, a condition where the arteries that supply blood to the limbs are narrowed, are particularly susceptible to leg cramps. Another problem that can reduce blood flow to the muscles is peripheral neuropathy. This is a common condition in which nerves that carry signals between the brain and the spinal cord are damaged. Neuropathy can cause a variety of symptoms, including tingling, burning, pins and needles, sensations, and muscle weakness. And guess what? It can also cause painful leg cramps at night. Peripheral neuropathy is most common in people with diabetes, but it can affect anyone. Okay, now that you're aware of the medical causes of leg cramps at night, let's discuss what you can do to stop them. We've put together an easy step-by-step guide to help you find relief. The first step is increasing your fluid intake. Again, staying hydrated is crucial to prevent cramps due to dehydration. Make sure you drink enough water throughout the day and avoid sugary and caffeinated beverages that can dehydrate you. To keep track of your fluid intake, try using a water tracking app or simply mark times on your calendar to remind yourself to drink up. Next, consider taking an electrolyte supplement. Electrolytes play a vital role in muscle function. and nerve impulse transmission. Taking an electrolyte supplement can help restore the balance of essential minerals like calcium, magnesium, and potassium in your body and prevent cramps. Before taking any supplements, though, consult your doctor, especially if you have any underlying medical conditions or are taking medications. Let's move on to tip no. 3. Improving blood circulation. If poor blood flow is contributing to your leg cramps, you can try improving circulation by getting regular exercise, especially cardiovascular exercises like walking, swimming, or cycling. These activities help strengthen your heart and improve blood flow throughout your body. In addition, you can also benefit from wearing compression socks, which can help improve blood flow in your legs and reduce swelling. Tip number 4. Stretch your muscles regularly. Stretching your leg muscles before going to bed can help relieve cramps. Stand up and walk around for a few minutes to get your blood flowing, and then slowly begin to stretch your calf muscles by pulling your toes towards your nose. Hold each stretch for about 30 seconds and repeat several times. You can also stretch your leg muscles by sitting down and extending one leg out straight and reaching towards your foot. Gently pull your toes towards you until you feel a stretch in your calf and hold for 30 seconds. Repeat with the other leg. Gentle yoga poses like downward-facing dog and child S pose can also help stretch your leg muscles and promote relaxation. Finally, massage the cramped muscle. Massaging the affected area can help relax the muscles and improve blood flow, relieving cramps. Use a firm but gentle pressure and focus on the calf muscles. You can do this yourself or ask a family member or friend to do it for you. We hope that these tips help alleviate your leg cramps and improve your sleep quality. Remember, it may take some time to find the best approach, so be patient and persistent in your efforts. If you have tried these remedies and your leg cramps continue to bother you, we strongly advise you to schedule an appointment with your doctor. They will perform a physical examination, ask about your symptoms, and may order blood tests or imaging studies to determine the underlying cause of your cramps. Based on the diagnosis, your doctor will develop a personalized treatment plan to help you find relief. Thank you for watching today's video. If you found it helpful, please hit the like button, comment below, and share it with anyone who might benefit from this information. Don't forget to subscribe for more valuable content coming your way. Stay healthy and take care. Hi, everyone. I'm here. I'm a fourth-year medical student at a university, and today we're going to be talking about brain tumors. In this video, I will go over the top 3 most common types of brain tumors. And if you stay till the end, I will share with you one rare type of brain tumor that actually happened to my grandfather. So let's get right into it. The 3 most common types of brain tumors are meningiomas, pituitary adenomas, and all of these are benign tumors, which means that they are meningiomas, making up 16% of all primary brain tumors, meaning that they occur in the brain itself. These are tumors that arise from the meninges, which is the covering of the brain and the spinal cord. They are usually slow-growing tumors, and they tend to affect adults more than children. The most common symptoms would be seizures, headaches, and then also focal neurological signs depending on where the tumor is located. So for example, if it is in the area of the brain that controls movement, then the patient may have weakness on one side of the body. But if it causes compression of the optic nerve, it can cause vision problems. The next most common type of brain tumor is a pituitary adenoma. This makes up about 10% of all brain tumors. Pituitary adenomas are tumors that arise from the pituitary gland, which is a small gland at the base of the brain that produces several important hormones. These hormones include growth hormone, thyroid-stimulating hormone, adrenal follicle-stimulating hormone, luteinizing hormone, and also prolactin. The problem with these hormones is that when there is a pituitary adenoma, there is either an excess or a deficiency of these hormones. So for example, if there is an excess of growth hormone, this can lead to gigantism in children or acromegaly in adults. Whereas if there is a deficiency of antithyroid stimulating hormone, this can lead to hypothyroidism. And lastly, if there is an excess of prolactin, this can cause problems with fertility or also problems with menstrual cycles in women. And sometimes there may not be any symptoms at all, and the tumor may only be discovered incidentally on an MRI scan of the brain. And the last type of tumor I want to talk about is this is the most common type of malignant or cancerous brain tumor in children. It makes up about 20% of all childhood brain tumors. It arises in the cerebellum, which is at the back part of the brain, and it tends to spread throughout the whole brain. The main treatment for medulloblastoma is surgery, radiation, therapy, and also chemotherapy. And the survival rate for children who have this tumor is about 70 to 90%. Now that we've gone over the 3 most common types of brain tumors, I'm going to talk about one rare type of brain tumor that actually affected my grandfather. My grandfather had a meningioma, which was not the typical type that you see most commonly. His was actually called a Somamedes meningioma. This type of meningioma is very rare, making up only 3% of all meningiomas, and this type tends to affect older people like my grandfather. He was 78 years old, and also, this type of tumor has a more worrisome histological appearance under the microscope, but it is still a benign tumor. So, the good news is that it is not cancerous. However, because of his age, he was not able to undergo surgery. And so, he received radiation therapy. Unfortunately, the tumor came back a year later, and then he received more radiation therapy. And this time, it did not come back. All right, everyone, that is all I have for you today. I hope that you enjoyed this video and learned something new. If you do have any questions, please leave them in the comment section down below. And if you haven't already, please click the subscribe button so you don't miss out on future videos. And lastly, thank you so much to all my supporters for your generous support. All right, everyone, take care, and I'll see you next time. As a brain doctor, I am begging seniors to stop this shower habit. This can cause blood clots. Welcome back to our channel. As a professional, I want to discuss something that many people do every day, but do not know how dangerous it is. In this case, we're talking about showering. For most people, showering is a great habit. It keeps us clean, prevents body odor, and helps maintain good hygiene. However, there are certain things you should never do in the shower, especially if you are a senior citizen. And today, I will tell you why. Now, before I explain why, please take a moment to subscribe to my channel. Just click on that button so you won't miss out on any health tips for a happier and better life. Also, be sure to like this video and share it with your friends so they can benefit from what I am going to share. Now, let's get started. First of all, as a brain doctor, I have seen firsthand how many seniors suffer from stroke and other vascular problems due to blood clots. Blood clots can be caused by a number of factors, including age, genetics, and medical history. But did you know that there is also one more thing that can increase your risk of developing blood clots? Taking long hot showers or baths. Now, you may be thinking, what's the big deal about taking a shower? We all need to wash ourselves, and staying clean is important for our health. Well, here's the thing. When you take a hot shower or bath, your body temperature rises rapidly. This causes your blood vessels to expand, which makes it easier for blood to flow through them. At the same time, your heart rate increases in order to pump blood faster. These changes can put a strain on your heart and make it harder for it to pump blood effectively, which can lead to blood clots. It is well known that older adults are at an increased risk of developing blood clots because their blood tends to be thicker than that of younger people. When you combine age with hot showers, you double your risk of developing blood clots. On top of that, if you already have a medical condition that affects your blood flow, such as high blood pressure or diabetes, then things become even more risky. Many studies have shown that taking hot showers or baths can lead to blood clots. In fact, some studies have even linked hot tubs and saunas to the formation of blood clots. The reason for this is simple. When your body is exposed to high temperatures, it causes your blood to become more concentrated and viscous, which makes it more likely to clot. This is because when blood is heated, the proteins and other components that make up its plasma expand, causing the blood to thicken. Additionally, high temperatures can activate certain clotting factors in the blood, further increasing the risk of clot formation. It's not just the temperature of the water that matters, but also the length of your shower. Studies have found that taking showers that are longer than 30 minutes can also increase the risk of blood clots. Prolonged exposure to heat can dehydrate your body, which can make your blood more concentrated and thick, leading to a higher risk of clotting. So what exactly is the ideal shower temperature and duration for older adults? According to experts, the best temperature for a shower is between 98.6 and 104 degrees Fahrenheit or 37 to 38 degrees Celsius. The duration of the shower should also be kept in mind, and it should not exceed 20 minutes. Staying in the shower for too long can cause dehydration and make the skin dry, which can lead to irritation and even infection. I know that many people love to spend hours in the shower, especially when they are retired and have all the time in the world. However, it's important to remember that as we age, our bodies change, and what may be comfortable for us in our younger years may become dangerous in our later years. As a brain specialist who treats stroke patients, I can tell you from experience how devastating it is to see someone suffer from a stroke and how it can affect their life and the lives of their loved ones. Many patients and their families tell me that they had no idea that something so simple could cause such a serious problem. If you are concerned about the risk of blood clots, you should talk to your doctor about ways to prevent them. One way to reduce your risk is by staying active and exercising regularly. Exercise helps to keep your blood flowing smoothly and reduces the risk of blood clots. If you are unable to exercise, then at least get up and move around every half an hour when you are sitting for long periods of time. Sitting for long periods of time can make your blood more likely to clot. So getting up and moving around can help keep your blood flowing and reduce the risk of clots. Another thing you can do is drink plenty of water throughout the day. This will help keep your blood from becoming too concentrated and thick, which can lead to clots. You should also avoid smoking and secondhand smoke, as tobacco smoke damages the lining of your blood vessels and makes it more likely for clots to form. There are also some medications that can help reduce the risk of blood clots. If you are at high risk for clots, then talk to your doctor about whether or not you should take these medications. One common medication used to prevent clots is called warfarin, which is also known as Warfarin is a blood thinner that helps to reduce the risk of clots by preventing the blood from clotting to However, it is important to note that warfarin is a potent medication, and it is essential to take it exactly as prescribed by a doctor, since an overdose can lead to excessive bleeding. Therefore, if you are considering taking warfarin, it is important to weigh the risks and benefits carefully and follow your doctor's instructions closely. Another medication that can be used to prevent clots is a class of drugs known as direct oral which includes medications such as apixaban, privaroxaban, dabigatran, edoxaban, and vetrixaban. These medications are newer than warfarin, and they offer some advantages such as a more predictable dosing schedule and fewer drug interactions. However, they can also be more expensive, and they may not be suitable for everyone. For example, some of these medications can interact with other drugs you may be taking, such as those for high blood pressure or diabetes. They can also cause side effects such as bleeding and an increased risk of stroke. Ultimately, the best medication to prevent clots will vary depending on the individual and their specific circumstances. It is important to work closely with your doctor to determine which medication is right for you. And now, I would like to hear from you. What do you think about what I shared? Have you ever heard of these shower dangers? Let us know in the comments below. And finally, please do not forget to subscribe so you can be informed whenever I post new videos. Thank you for watching. Stay healthy and see you soon. As a brain doctor, I am begging seniors to stop this shower habit. This can cause blood clots. Did you know that taking long, hot showers can be dangerous for seniors? It can increase the risk of blood clots due to rapid increase in body temperature and heart rate, which puts a strain on the heart. Experts recommend keeping shower temperature between 98.6 and 104 degrees Fahrenheit, or 37 to 38 degrees Celsius, and limiting the duration to 20 minutes. Older adults should also avoid spending more than 30 minutes in one place, and should get up and move around every half an hour to keep their blood flowing and reduce the risk of clots. Other preventive measures include drinking plenty of water, avoiding smoking, and secondhand smoke. And talking to your doctor about medications that can help reduce the risk of blood clots. Remember, small changes can make a big difference in keeping you healthy and safe. Stay smart. Stay safe. Hi guys! Welcome back to my channel. It's me! And today I am so excited because we are starting our 7 days to a happier, healthier you challenge series. This is something that I have been planning for a while now, and it is finally happening. So what is this challenge series all about? Well, basically, it's a series of 7 videos where each day I will be focusing on one area of my life that I want to improve or just start living more intentionally in. And at the end of the 7 days, I will come back on the last video and tell you what I learned and how I felt like I grew as a person. So why am I doing this? Well, firstly, I really like the whole idea of challenges. Because when you commit to something publicly, you're more likely to do it. And secondly, I wanted to share with you my wellness journey. Because I feel like we do want to talk enough about it. We're always told to have these big goals and to get these aesthetic results. But no one talks about the real work that goes into actually being healthy and feeling good. Being fit and having visible ABs isn't the same as being healthy. And honestly, if that's your goal, you should just stop right now and find another fitness influencer who promotes a more realistic and healthy way of exercising. So what are some of the things that I want to work on? Well, I want to work on my flexibility because I am really stiff and I want to be able to do splits. I want to work on my strength because I feel like I'm quite weak. I also want to work on my mindset and my journaling practice. I want to work on my productivity and time management, because I'm really bad at that. I want to work on cooking healthy food and meal prepping. I also want to work on my reading practice and improving my English. So, how can you join me on this challenge? Well, I encourage you to grab a journal and every day take note of the things that you want to improve on and write down the steps that you need to take to achieve them. For example, if you want to improve your productivity, then write down all the things that you need to do to achieve that, like setting up a workspace or finding an accountability partner. And then at the end of the 7 days, come back to your journal and reflect on what you have achieved, what you could have done better, and what you have learned about yourself. You can also share your progress with me on social media using the hashtag provided. Okay, so let's get into the first prompt of day 1. What is one small step that you can take today to move you closer to your goal? Don't think too hard about this one. Just write down one small thing that you can do today to get started. For example, if your goal is to read more, then your small step could be to set a timer for 10 minutes and read a book that you're interested in. If your goal is to improve your Spanish, then your small step could be to download a language learning app and spend 15 minutes practicing. If your goal is to save money, then your small step could be to track your expenses for 1 day. See how this works? By breaking down your bigger goal into smaller, more manageable steps. Okay! So this is the end of day 1. I hope you enjoyed this video, and I hope that you re-excited for the rest of the challenge series. Make sure to follow if you haven't already, and I will see you in the next video. Bye!